So we are on live stream now. So I think we are good to go. So Faisal, please start the process. Thank you.
Yeah. Okay. Shall we start? Okay.
Yes,
Good evening,
please.
good afternoon, and good morning to everyone from all over the world. A very warm welcome to our session 6 of the Global Advanced Certification Program on strategic research collaboration. Good evening, good afternoon, and good morning to everyone from all.
What's happening? Why is the echo happening?
That was echo, sorry. So, a very warm welcome to session
No problem.
6
Please.
of the Global Advanced Certification Program on Strategic Research Collaboration and Communication for Emerging Researchers and the International Workshop Series, proudly organized by the Global Consortium of Global Health Actors, Leaders, and Thinkers in collaboration with Bangladesh Institute of Innovative Health Research. Today marks the session 6 of our international workshop and panel discussion series, which is already featured by eminent speakers from all over the world each weekend. So far, we have had a few preeminent and renowned speakers from top academic institutions of Africa, Australia, India, Malaysia, and the USA. We are deeply honored to host two engaging panel discussions today evening featuring distinguished leaders in mental health, One Health research, and global health policy. These sessions will shed light on both systemic healthcare inclusion and visionary advocacy strategies across Asia and the Pacific. We are once again joined by Professor Maheswar Satpathy, the CEO of Global Alt and Director of COE ECCPH India, who will be moderating both panels. Global Consortium of Global Health Actors, Leaders, and Thinkers operates under the Global Health Leadership by Global South Initiative, a flagship project of the Global Health Forum. The consortium brings together global health experts, leaders, researchers, practitioners, and policymakers, especially from developing and underrepresented regions, to collaborate on transformative research that drives equity and systemic change in health. As of today, the Global Consortium is the largest dedicated professional consortium of global health with more than 1,800 leaders from 170 plus countries who have applied to be members with a rigorous process of member selection. Our vision is reimagining global health leadership by the Global South, decolonizing global health. We are the global alternative. Bangladesh Institute of Innovative Health Research is a non-profit student-led research organization that promotes research culture among students and early career researchers. Nearly 40 students contribute as research assistants and over 10 serve in core managerial roles. BIHR is actively conducting public health research and regularly organizing training, workshops, and seminars to build capacity among emerging scholars. Some ground rules for our session participants. Please stay muted during the session unless invited to speak. Use the chat box or Q&A for any questions or reflections you want to share with our speaker. Attendance will be tracked from start to end, and also a attendance form will be shared with you during the session. So maintain a respectful and inclusive environment throughout the session. Our first panel today is putting mental health at the center and focus of healthcare, the role of mental health professionals and organizations in strategic science and policy communication. We are very honored to welcome Dr. Amrit Pattojoshi, Professor and Head of Psychiatry, High Tech Medical College, Utkal University, Bhubaneswar, Odisha, India, and General Secretary, Indian Psychiatric Society, and Joint Secretary, SARC Psychiatric Federation. Moderated by our respected Professor Maheswar Satpathy, who is a world-renowned leader in One Health, global health, planetary health, brain and mental health. He is a much sought after expert in epidemiology, health emergencies and implementation science, and health innovation using the power of emerging and futuristic technologies such as AI, ML, LLM, and generative AI, and geospatial information systems, science, and technologies, and remote sensing. He builds on his core areas of expertise in cognitive and computational neuroscience, psychology, and global health to benefit the humanity. His sustained engagement with UN Sustainable Development Goals and ethics in the broader area of public policy has led to holistic societal transformations in various LMICs. Professor Satpathy has a humble H index of 78 and cumulative citations over 154,000 plus. He has published extensively 285 plus peer-reviewed scientific articles and book chapters in journals of global repute, notably in Science, Nature, The Lancet, NEJM, JAMA, BMJ, Circulation, PLOS, Frontiers, Elsevier, and many more, and has offered keynotes and invited talks at more than 200 top international conferences and global congresses in the past 20 years. He has an impressive all-metrics score of 68,255, exemplifying the large-scale social impact driven by their work. Professor Satpathy is currently a research fellow at the Institute of Global Health and UCL Global Business School for Health of University College London, UK, and also is a substantive faculty member at Utkal University, Bhubaneswar, India. He is the director and lead of Center of Excellence in Environment, Climate Change and Public Health and Policy, a joint initiative of Government of India and Odisha since 2023. In addition, he is also coordinating the Center of Excellence in Governance and Public Policy. In the past, he has occupied prestigious positions as research scientist at UNSW Sydney, AIMS New Delhi, and consultant clinical psychology and assistant professor at Army Hospital RNR New Delhi. He has held visiting researcherships, fellowships at University of Oxford and Columbia University in the city of New York. He was a he was a global health consultant, Dalla Lana School of Public Health, University of Toronto between 2020 to 2023. Professor Satpathy is an established scholar engaged with planetary health and well-being, global health, mental health, transdisciplinary gender and sexuality studies, and critical development studies focused on sexual and reproductive health and rights, and policies and ethics of social justice, and aim to nurture peace and harmony in the world. Professor Satpathy has an extremely diverse educational and training background, starting with clinical psychology, BA Psychology Honors, Gold Medalist from Utkal University, Masters in Applied Clinical Psychology from University of Delhi, Gold Medalist, and Public Health Certificate in HIV or AIDS Management, Seed Action France. Subsequently, Professor Satpathy has completed an advanced MSc in Global Health and Development at UCL London, UK with distinction, and an MPhil in Public Health from University of Cambridge, UK, also with a distinction. MD and MPH in Global Health Systems and Health Policy from Harvard Medical School and Harvard T.H. Chan School of Public Health, Harvard University. Previously, he had also pursued a PhD in Health Sciences at the UNSW Sydney with Australian government most coveted Australian Leadership Awards, researching on syndemic minority stress perspective and HIV or AIDS. In addition, he has completed an LLM in Human Rights from Graduate Institute, Geneva, PGD in Human Rights Law, and PGD in Medical Law and Ethics from National Law School, University Bangalore, Advanced Diploma in International Humanitarian Law from Nalsar University, Hyderabad, MA in Public Administration from Jamia Millia Islamia, first class first, and is completing MSc in Data Science, Applied AI Focus from Northwestern University, USA. He has a successful record of over 20 years in designing, delivering, and evaluating global and national public health programs. His multifaceted engagements in Asia Pacific, Africa, and Europe, and clinical practice in India have contributed to my well-grounded perspective and expertise. So I will request Professor Satpathy to introduce our esteemed guest today, Dr. Amrit Pattojoshi, and lead the important panel. Thank you.
Yes. Okay, thank you so much, Hazel, for such a brilliant and a little bit longer introduction. But I think that's the protocol. So we have to also do our dues. And so I have the distinct pleasure and privilege of introducing Professor Dr. Amrit Patajoshi here. Professor Dr. Amrit Patajoshi is currently the professor and head of Department of Psychiatry, High Tech Medical College, affiliated to Utkal University, Bhubaneswar, Odisha, India. He is Honorary General Secretary of Indian Psychiatric Society, the largest body for Indian psychiatrists. He is also serving as the Joint Secretary of SARC Psychiatric Federation. It's a very prestigious organization in charge of the psychiatrists from all over the SARC region, which is basically consists of 7 to 8 countries, depending on how you classify the SARC. He is a very renowned and much sought after clinician. I was going through his profile and it's brilliant. The kind of work he does. I know him for about 15 years and I'm very, very inspired by the kind of work he does. So he's a very brilliant clinician, basically a neuropsychiatrist. And thankfully, it's also my area of expertise, neuropsychiatry and neuropsychology. He's a passionate educator, he's very avid social reformer, and I can testify that because he's always doing something. Every time I ask, like, what are you doing? He's always doing something, and he's definitely part of several social policy reforms and activities. He's an erudite speaker, which will be, clear today to all of you, because all of you will see the strength of his speaking, and he's a prolific writer. So if you ever get an opportunity, please have organize some time to read some of his work. I think I really love his writing as well. He publishes a lot of very policy oriented and public writing, which is published in newspapers and many other magazines. And I think that's how science communication should be done. And that's the reason why we have invited him as one of the keynote speakers for today. He is a wellness mentor of Odisha Football Club by the government of Odisha, appointed by the government of Odisha. He's a very well-known LGBTQI health and rights advocate. Again, another similarity with me, the same as mine. And he's a social activist, and also he's a TEDx speaker. So he's a very famous person in terms of media presence, and he's literally on daily basis, he is featured in some magazines, some newspaper, some TV series, something happening. He is always on the TV. Every day you can look at him, and that is probably one of the reasons. Also, we would love to have you today, and it's a distinct pleasure to have your time, Dr. Patajoshi. As of now, Professor Patajoshi, being an extremely busy clinician, has more than 50 publications in journals of repute. He has close to 1,000 cumulative citations and an H index of 8. He is also the editor of IPS, Indian Psychiatric Society textbook on postgraduate psychiatry for MD, DND, and DPM students for the Indian medical graduates. So with this very generous introduction, I wanted him to provide a very long introduction. I tried to Google many things, but the kind of things which are there on the media, if I have to sum it up and condense it, I think it will go over like an entire book. So I cannot do that in this short amount of time. So I thought, like, I'll just do the same thing what Professor Patajoshi just provided. I'll just read it out about him rather than making any changes. And I'm extremely privileged and very, very happy to have my friend and dear colleague, Dr. Amrit Patajoshi, on stage today to share the stage of Advanced Certification Program and also the International Workshop Series participants. So our workshop participants are slowly joining. I can see the rising number, but now I would request Professor Patajoshi to kindly do the honor of making his presentation, and so that you will all be enlightened by his erudite work. Thank you. Thank you. The stage is all yours.
Thank you, Professor Mahanti. First of all, let me congratulate you on the extremely brilliant CV you have got. Your CV is 1,000 times more powerful than my CV. The work you do, the amount of things you have, I think it's amazing. I think we need to take a piece of your DNA and analyze it and find out how somebody can be so brilliant. And let me congratulate you on the multifaceted work you're doing. And it's I think I should switch off my video and hide after seeing you.
No. You are the guest today, and you are on the spotlight. And we are very honored to have you, Professor Patajoshi. Besides being a colleague, you are my friend first. And I think that's the first thing that we must acknowledge that. And I'm completely and fully honored by your saying this, making this statement on call. and I'm fully humble. So thank you. Yeah, please.
So much. So when my friend Maheswar told me to talk on this, I think this is something I am somebody who works a lot with the government. I am a mental health advocate. I am the head of the organization. I'm the secretary, is the most important post. I am always liaising with the government, with different institutes, with different policies. And somewhere, but speaking on this topic on a global platform has been given. Today was Sunday. I've not gone out anywhere. I've been preparing what to tell, what not to tell. And somewhere it will sound a little disjointed. It will not make much sense when I'm speaking, but I'll just tell you, just close your eyes for a minute. Every one of you who is listening to me, please close your eyes for just a minute and just imagine that, just imagine a world where every community meeting, every government health policy, every media campaign, every hospital boardroom, and every school classroom starts with one simple question: how does this affect mental health? Just imagine. That's it. Open your eyes. That's the world I'm asking you to imagine and build together. Everything which we do, every word we speak, every behavior, somewhere or the other, empires or imparts or does something to mental health. The way we speak, the way we behave, the way we take care of our people, the way we set targets for children, the way we look after our parents, the way the policies are there for colleges, admissions, jobs, marriages, relationships, substance, every policy. Just imagine what it does to the mental health. And we want a world which is, little safer, little clearer, little happier. I think that's what we want. And if you look at the what is happening to mental health, 1 billion people in the world are living with a mental disorder. And if you look at a place like, our subcontinent, we have a lot of things, but most of the people are not very happy with life. Some way or the other, people are not happy with their life. Greater than 80% of people with mental health disorders are living in lower middle socioeconomic countries, you know. And post COVID, if you look at COVID, there's a benchmark. You talk about AD, you talk about BC when we talk about history. But when we talk about mental health and its history, I always talk about pre-COVID and post-COVID. And COVID really opened our your eyes and our mind to the danger of mental health issues. And I think everybody has gone through it. When we're living in isolation, when we're seeing people around us dying, when we're worried about what might happen to us, when we're worried about the cleanliness, and somewhere it was a benchmark on how important mental health is for society at large. So with this, I would like to start my talk, putting mental health at the center of public health. The role of mental health professionals and organizations in strategic science and policy communication. I'm not very, very good in all these things. Maheshwar, again, apologies if I aren't able to communicate what I want to say, but I have a passion. I do a lot of work and I've
No, the
taken.
kind of wisdom you have, Professor Pachajoshi, is like that is nothing sort of the oratory or anything. We just want to learn from all your years of experience,
So,
and I think our participants would greatly benefit. I'm
thank you so much.
confident.
Thank you so much. So, leave no one behind, transforming mental health through strategic science and policy. A global call for inclusive action. What we want is we want inclusions. Now, imagine a world where every individual, regardless of socioeconomic status, age, or geography, or again, I'll tell you, gender, has seamless access to high quality, stigma free mental health care. What transformative impact would that have on our communities, economies, and overall well being? Just imagine. Everything is not said. If you just understand the implication of taking care of the mental health of everybody around us, the ramifications are huge. Now, why mental health comes first? Mental health, what is mental health? It influences how we think, how we feel and behave, and it directly impacts physical health. Conditions like chronic stress, depression, and anxiety can trigger or worsen disease such as heart diseases, diabetes, and obesity. Mental health, suppose somebody has depression, somebody has anxiety, it just does not take a toll on your mental health. It also takes a toll on your physical health. Many of the people, nowadays, if you look at obesity, if you look at diabetes, if you look at hypertension, before we used to have all these diseases at the age of 50, 55. But now we are having 25-year-old people, 27-year-old people, 32-year-old people who are physically fit, but coming out with these diseases. And one of the most important issue is stress. And the most important issue is mental health. And that's what we need to take care of. And coming to the economic and social impact, untreated mental disorders lead to lost productivity, increased absenteeism, and higher healthcare costs. Social consequences include weakened family bonds. If you are depressed, if you are having mental health issues, you will have weaker bonds. There'll be community fragmentation and cycles of poverty. Once you're having some serious mental disorder, you don't work properly, you lose your job, you go to the lowest strata of society, and the cycle of poverty will increase. If you look at the economic cost, $6 trillion is the projected total cost of a defined set of mental health conditions. That is the projected cost. $12 billion productive work days are lost every year to depression and anxiety alone at a cost of nearly $1 trillion. Every year, 12 billion productive days are lost only because of depression and anxiety. Forget addiction, forget schizophrenia, forget the other mental health disorders. I'm just talking about the basic depression, anxiety. How much loss does it does to the economy? So that's how huge it is. Holistic care, integrating mental health with physical health services creates a comprehensive care model that not only treats illness but fosters a long-term well-being. We're always worried about physical well-being, physical well-being, physical well-being, never take care of the mental well-being. And once we integrate the mental health with physical health, the results you get are astounding and fabulous, because both of them are interdependent on each other. The cause for concern. If you look at National Mental Survey, and I am also part of the National Mental Survey, which is going on now. We're continuing with the National Mental Survey in Odisha, and I'm one of the investigators of this whole survey. It's a big survey, and we have come out with certain papers which we might be sharing or publishing very soon. If you look at suicides, again, everywhere now in India or the subcontinent outside, you see a lot of people doing all these things. So 28% of global suicides are occurring in India. If you look at access to mental health care, 49% had a mental health facility within 20-kilometer radius, and 26% reported no mental health facility within 50-kilometer radius. That's how huge it is. 59% reported lack of any de-addiction service in their area. If you look at addiction, it has become very prevalent, with people having more access to money, less responsibilities. The money is getting channelized to negative things like alcohol, cannabis, brown sugar, or heroin, whatever you tell, and a lot of other recreational drugs. And if somebody wants to get treated, 59% reported lack of any de-addiction service in their area. When we talk to people, 57% of people are telling that they are not aware of any person with mental illness. You sit in a room with 5 people, somebody or the other has a mental illness. People are not even aware of who has a mental health illness. 28% did not consider suicide to be associated with mental illness. They always thought that somebody has committed suicide. He might be having a financial issue. He might be having a relation issue. Nobody thought, almost 30% of people did not think that mental illness also leads to suicide. And if you look at insurance, people are insured for everything. But when it comes to mental health, 80 to 90% had no health insurance or thought mental health was not covered under insurance. So our vision is a healthier, more resilient society. Our long-term goal is to achieve a world where mental health is valued, promoted, and protected, and where individuals affected by mental health conditions can exercise their full human rights. Human rights is a very important issue when it comes to mental health, people with mental health issues, and access to high quality, culturally appropriated health and social care. When you're looking at different segments, if you're looking at a place like Saudi Arabia, you're looking at a place like America, looking at a place like Pakistan, you're looking at a place like Sri Lanka, everywhere, you need to take care of the culture. You need to take care of the belief systems of the people. When you are integrating mental health, issues or mental health policies into the country's system, the ultimate impact we want the ultimate impact is a healthier, more resilient, and thriving communities worldwide. With mental health as a central integrated component of public health. Public health does not mean just vaccination, maternal health, or perinatal health. It's mental health is also an important aspect, and public health should take care of the mental health component of the whole well-being or good health. Now, why prevention matters beyond economics? We are now not looking at a model where we are taking care of patients in terms of only tertiary treatment or secondary treatment, but looking at primary treatments and primary prevention, that is prevention. So I have been in talks when I'll be talking, I'll be also talking about certain policies which there's a very good policy in Mumbai which I wanted to integrate in our state. It's a happy school project where we're looking at integrating mental health courses in school curriculum. Sometimes it is much more important than some of the theories, Pythagoras theorem or some other theorem which people are reading and which they have never used. I don't know whether I have used those algorithms in my life after I passed out from school. When you talk about resilience, when we talk about coping skills, when you talk about people being happy, when you talk about people, understanding the other, the mental health of others, when you talk about bullying, when you talk about, a lot of online behaviors, how it is impacting people, we need to go into schools. And that's where prevention is very important. We're not just looking at the economics that yes, somebody is 25-year-old and he's not able to work. So what we are losing, we need to look beyond the economics. And mental health promotion and prevention effort reduce stigma, isolation, and systemic inequities. Removing the systemic inequities is one of the important aspects of any policy we are going to do. And that's one of the most important aspects. So we are looking at combating social issues and we are also looking at addressing health inequities. So our theory of change envisions a world where mental health is valued, protected, and promoted as a fundamental human right. You need to take care of that. It is fundamental to any right. Mental health promotion should be one of the fundamental rights. So the economic case for prevention. So if you look at mental health, now when we look at investment, we look at land, we look at you know shares, we look at gold, but for every $1 that is invested in mental health, you get $24. You understand the return? It is 2,400 percentage. That's the highest return on investment on anything. You talk about Bitcoin, you talk about this. Nobody gives you better return than investing in mental health. And I'm telling you from experience, if you invest in school mental health, you invest in college mental health, you get a society which is more resilient, more stronger, happier, and the productivity is much better. So 40% of mental health dallies are avoidable by 2030 if you invest properly. One in four people will experience a mental health condition in their whole lifetime. I think it's not one in four, it is one in two. Because if you look at people who seek help for mental health, it is the lowest. We did a survey in the National Mental Health Survey. We are doing it now, 2025. Health seeking behavior was only 10%. 90% people with mental health issues, many of them did not understand that what they are suffering is because of mental health issue, that they need treatment, and many of them did not turn up because of the stigma associated with mental health. So one in four people, or one in two for me, will experience a mental health condition the whole lifetime. And 80% to 90% in low income countries lack access to treatment. This is WHO 2023 data. And preventing mental health disorder is not only a humanitarian priority, it has a lot of humanitarian things embedded in it, but also a smart economic investment. With strategic policy and science-based intervention, we can reduce suffering, improve productivity, and achieve significant economic returns, especially in underserved population. When you look at vulnerabilities, childhood is one of the major areas of vulnerability. Adverse childhood experiences include abuse. A lot of families have abuse in terms of physical, emotional, and not the least sexual. A lot of neglect in families, household dysfunction, which the husband and wife are not getting along well. There's a lot of violence among the couples. There's substance abuse by one of the partners. And there is a strong link between adverse childhood experiences and depression, anxiety, substance use disorders, conduct disorders, and personality issues. So, what does adverse childhood experiences do? They disrupt the emotional development and brain function, increasing long-term risk for mental illness. Early intervention and trauma-informed care are critical to break the cycle. So, early intervention when people are in schools, if the teacher is able to identify many times the teachers only tell that you have not brought your book, you have not brought your tiffin, you're not maintaining your hygiene, but they never think beyond that level. Why one child out of 40 is not bringing the food properly? Why one in the 30 is being abusive in class? Why one in the 25 is not sitting down quietly? You know, if you just think a little ahead and a little deeply, you just don't treat every child equally. That makes them unequal. Somebody comes from a disturbed family, you can just take 5 minutes with the child and tell why are you not bringing your tiffin to school? I think school-based interventions are very, very important, where we make every teacher a part of the mental health policy. And I think I'm now working to make that happy school project. At least I'll talk to the CBSE board or the ISC board and try to integrate into the education system that students from fifth to eighth will have access to a lot of materials on how to handle mental health issues. And I think that will go a long way in making our country much more happier than the position we are today in. And when I'm talking about my country, I'm also talking about the other countries. I see most of the countries who are participating are from the Asian region, SAARC region, and the African region. And I think we can be happier. So what does all these things lead to? Trauma in terms of violence, abuse, conflict. There's loss. A lot of people lose their parents, lose their siblings. A lot of people who are under poverty. Discrimination is very, very high, be it religion bias, be it caste bias, be it gender bias, be it sexual orientation bias. A lot of discrimination in society. And these adversities disrupt emotional well-being, limit access to care and support, and deepen existing inequality. So gradually, they will only deepen the existing inequalities. Prevention across early life, antenatal. We have a lot of antenatal support system, and I'm currently for the we are doing a course for antenatal and perinatal mental health. So let's support females during pregnancy. It shapes healthy brain development. Parenting. I see a lot of people now getting into marriages and making contracts that will not have children. I think parenting is a skill that needs to be taught to people. I think after you marry, there should be courses on how to be a good parent. Parenting is the toughest job now. I see a lot of parents coming with children, disruptive behaviors, people who are only hooked to mobiles, who become very aggressive, very irritable, very hyperactive. I think programs need to be made that nurtures early childhood mental well-being. And I think parents will be big, you know, pillars of how we develop this program. Prevention. Early action. If we know somebody is going through adverse childhood experiences, somebody is coming from a disturbed family, somebody is being abused, we need to intervene very, very early. We need to intervene before mental health issues develop, before depression occurs, before a post-traumatic stress disorder occurs. We need to intervene early. That's how prevention across early life occurs. Prevention is adulthood and latehood, workplace. Now, a lot of post-COVID, we see a lot of people now getting into wellness. Wellness programs support emotional and psychological health. We need to take care of the wellness of the employees, of our colleagues, and even of us seniors. Inclusion is very important. If you engage the community engage. Suppose there are Rotary clubs, there are Lions club. We engage them in mental health programs. We signed a memorandum with the Rotary club where we took care of a lot of things which they were doing. They would accelerate and we would go to communities and help them. So community engagement reduces isolation stigma. We would go to slums and talk about substance abuse. We would teach the ladies how to identify if the partners are taking alcohol or a cannabis or a brown sugar. So we go to communities, we tell them that every problem has a solution. We tell them that getting into mental health issues is not stigmatizing, but if you don't take care of them, if you don't get treated, then it is a stigma. It increases the stigma. And if you look at mental well-being actually improves longevity. The more stress-free you are, the longer you live and the happier you live. So resilience is the most important issue we need to invest in. I'm always on TV and radio speaking on a lot of school mental health programs, college mental health programs. Our government ran a program where all the colleges were entwined in a My College scheme. That is an initiative where all the government and semi-government colleges. So we before exams, post exams would conduct webinars on how to improve the well-being, how to improve resilience, how to prevent suicide. We also ran a smart city campaign where we would go to campuses. We talk about, gender inequality. We would talk about substance abuse. We would take care of, we keep gatekeepers. Every class will keep 3 or 4 people who would report to us who is taking substance, how we can help them. So resilience building is an important aspect. Going to campuses and working on people's mental health is a very, very important aspect. And I think many of the governments, local governments are now heavily investing into this. Schools are now investing into counselors, they're keeping counselors. They're not averse. A lot of principals are on a phone call with me. They will call me up and tell Dr. Amrit, we're having a problem with this child. Can you please help? So we are always there because we know that a little bit of change, a little bit of intervention will lead to so much improvement in somebody. And resilience building is very, very important aspect in the whole curriculum, in the whole school setup, in the whole family setup, where we talk about regular exercises, we talk about adequate sleep, we talk about nutrition, we talk about mindfulness training. I see many of the people who are there in somewhere, but their mind is somewhere. So mindfulness is very, very important, whether you're eating, you're working, you're doing a workout, you're roaming around, be where you are. Do what you're doing and put your mind wherever you are. Deep breathing is something which we need to teach people. That is how you need to relax. Social connectedness is an important aspect. With the advent of social media, our social connectedness has reduced significantly. Now we're only connected via a Insta or a WhatsApp or a Snapchat or something else or a Tinder or XYZ. But the real connectedness has reduced significantly. And I think we need to work on the social connectedness much more. We need to throw our mobiles and just sit down and talk. We need to enhance our emotional regulation. That will naturally lead to reduction of symptoms of anxiety and depression and build long-term resilience. And if you look at positive lifestyle habits, just regular exercise, a good sleep, a balanced nutrition, not touching alcohol, cigarettes, or any substance will improve mental health count by 35%. And that is huge. And daily habits are part of the resilience domain. You don't think that policies means just big, big things. Even the small things and the minor things will lead to 35% improvement in mental health. The core pillars are equity and social justice, prevention and early intervention, and innovation and integration. That's the most important thing. Leveraging tools like the theory of change allows us to design strategies that connect grassroots efforts to systemic policy. We are looking at grassroots efforts as well as policy shifts. And that is where I think people like Maheswar and the entire team will be very, very helpful. How to innovate and how to integrate the whole system is very important. So, application on the theory of change in mental health. So, inputs, we have resources, partnerships, technological solution expert, activities, we do take care of a lot of training programs, awareness initiatives. We need to make people aware of mental health issues, policy dialogues, digital innovations. Digital innovations are very important. A lot of apps have come out now. Telemental health is a very, very important thing. We run a telemanas. The government of India runs a telemanas scheme where we have a number where anybody with a mental health issue, if he wants a counseling, somebody wants therapy, can directly communicate. It's a toll-free number. You directly call, and if there is an issue which the telecaller cannot, you know, manage, it is escalated to the next level. So we with the advent of technology, we have a lot of things that have been coming out. During the COVID, when the second wave came, we saw a lot of young people dying, and the social isolation was severe. We saw suicides increase significantly. So I was looking up the National Suicide Anti-Suicide Helpline, but due to scarcity of fund, I and one of my senior colleague ran a nationwide. In the first wave, we ran a national suicide helpline for only doctors. And the second wave, we ran a national anti-suicide helpline for all common people. We recruited people and we ran from 9 to 5, there are a lot of people who are there with individual. But after 5, the isolation increases. So we ran a anti-suicide helpline from evening 5 o'clock to morning 5 o'clock. And I'll tell you that we managed to save a lot of lives. People would call us up, we would handle them, we would take care of the immediate crisis that occurs. Even the and thankfully the government also took cognizance of the fact that we are running a helpline, and they started running a helpline. So that helpline we ran for 2 years. Again, I have become the secretary of this society, and our society is planning to build another suicide helpline. And even this time we have a midterm central CME. We our theme is about suicide. Suicide is an important aspect now, and we need to handle suicide properly. We need to do things that will prevent suicide. We cannot prevent every suicide, but many of the suicides can be prevented by effective programs and effective implementation of the programs. So our vision is again a world where every person can access high quality stigma-free mental services. Stigma-free is a very important aspect. Many of the people don't come to us because there's stigma attached to mental health. So collaborations, building the ecosystem for change, government and policy makers. So role in collaboration, policy formulation, funding, regulation. Funding is an important thing, and regulations are very, very important thing. What are the contributions? Create and enforce mental policies, allocate sustainable budget, integrate mental health into national plans. Healthcare institutions and providers run awareness initiatives, policy dialogues, digital innovations. There's the National Mental Health Act. We have the National Mental Health Act, universal health coverage. We have been talking to a lot of insurance companies for universal health coverage and putting mental health into insurance. And we have been successful in building all these things. Community and NGOs and community organizations, they run awareness campaigns, pilot community programs, telemanas, telehealth apps. A lot of the academic and research institutions, people like Maheswar and his breed, need to, you know, develop and conduct all this program that we do. Digital innovations agencies and organizations translate research into research. As long as it is not translated into an actionable policy, it is of no use. So advocacy is very important. Strategic information and advocacy are very, very important role. Rights of person with mental illness. In a place like India, we have a National Mental Health Care Act, which is aped from the Western society, and those rights are very, very important. We cannot just lock up and throw people with mental illness, not take care about their needs, their rights, what they want. We cannot just think that what we think is right is the right thing. So rights of person with mental illness, very, very important thing. The Mental Health Care Act, which was passed in 2017, talks about informed consent, confidentiality, and least restrictive care models. Before they used to shut up people, they used to tie up people. I think those things are now gone. Educating individuals about the rights can improve treatment adherence and patient satisfaction. The policy of the people used to just tell that you take these medicines and come after 1 month is gone. Now is the time where we talk of patients, their rights, what they want out of the medications, what are the side effects they will have, what is convenient for them, and that is how we build adherence. Once adherence comes, the stigma reduces, the improvement is much more significant, and we have a society which has a lower proportion of people with serious mental health issues. And mental health professionals and organizations have a critical role in promoting and protecting the right of individuals with mental illness. Mental health is illnesses are a little different from physical illnesses, so their rights are very, very important, and it's very tough. So, role of NGOs in mental health, advocacy and policy influence. They're reducing by advocacy and policy influence. They reduce the stigma and push for reform. Educating and training, the increasing mental literacy is very, very important. 50% people don't know what is mental health. If somebody comes with a serious mental illness, they'll tell that you do yoga, you do exercise, you'll get okay. Community engagement and empowerment is very important. Fostering peer support and local initiatives. Everybody cannot come to cities, tier 2 or tier 1 or tier 3. There are a lot of people who are living in the rural areas, semi-rural areas. So local initiatives are very, very important. The top-down approach is also important. Direct support and services, providing counseling, crisis intervention, like we do with suicide helplines, we do with the telemanas in India. So very, very important, ways in which people are able to access or assess counseling and crisis intervention services. Research and data collection, studying mental health trends, like we're doing the mental health survey, national mental health survey. It's a very, very big project that is going on in the country, and I'm proud to be part of that. Supporting disadvantaged populations, addressing the needs of the vulnerable groups is very important. A lot of children are there with mental health issues, autism, with people with serious mental illness like severe depression, schizophrenia. So what will happen to them? How will they survive? How will they get medications? What after their support, support group, like the parents pass away, where will they go? How will they sustain? How will they buy medicines? Who will ensure they are taking medications? How will we ensure that they are safe? How will we ensure that the society is safe? So we need to support the disadvantaged populations by building certain things for them, building infrastructure for them, taking care of their needs. That's one important aspect which we are still lacking now. Lived experience and survivor-led approaches in mental health, advocacy and rights, challenging stigma, and promoting right-based policies are very important. Research, I was talking about research and peer support, service designed and delivery. We create a service and we can't deliver. That is of no use. So I think that's where things are very, very important. And ethical approaches. Ethics in mental health is a very, very important thing, and we need to take care of that. Engagement with society, government, and community stakeholders. Society fostering an open dialogue about mental health. The role of media. We go a lot into media. Day for yesterday, there was a report in the state media that one female was acting as if a snake has gone into her body. So there are a lot of things which we need to dispel, myths, a lot of culturally accepted things which should not be accepted, a lot of treatment modalities in terms of black magic, in terms of hitting people who are possessed, in terms of that's very, very important. The media has a very, very important role in fostering our viewpoints in talking about health issues, mental health issues, be it suicide, be it depression, be it schizophrenia, and that will change the public perception of mental health and stigma and create more awareness. Government advocating for robust mental health policies. We need better mental health policies. We need to increase the funding. The funding for mental health is only 1% of GDP, and must be minimum 5 to 6%. And integration of mental health into all public health initiatives. That's very important. Policy development is important, and I think that's where the NGOs are important, engaging with legislative bodies to ensure a rights-based and evidence-informed policies, building strong community-based mental health networks, leveraging local resources, and empowering. But we are teaching a lot of MBBS students how to take care of mental health. We're talking to ANMs, JNMs on how to identify and create awareness of mental health issues. Grassroots initiatives, the most important aspect. As long as if you don't reach to the grassroots, it's of no use. Supporting peer groups, local awareness events, and accessible community mental health services are very important. So strategic communication, clear message, crafting concise, compelling messages, audience analysis, understanding the target audience needs, and message development are important goals. That leads to informed decision making, increased transparency, and improved engagement. Engagement is a very, very vital thing nowadays. And the challenges are it is very, very complex. Policy making, you need to make evidence-based policy. You cannot ape what is happening in the UK or the US and try to thrust it up our neck. Stakeholder engagement, building relationship with stakeholders, policy briefs, collaboration, data-driven insights, and inclusive communications are very important challenges. For us, the future of community college public health initiatives, and we increased use of technology. Now, a lot of apps are come where you can identify mental health issues, collaboration with healthcare organizations, emphasis on mental health and addressing health disparities. Very important. Innovations. We have talked about all the innovations. We talk about public translation, research and advocacy, inclusive communication, equitable policy formation, improved health conditions. Ultimately, the end point is improved health conditions. So if you look at inclusive communication, there is equitable policy formation and improved health outcomes. The future mental health in the healthcare sector, increased funding for mental health care is the most essential part. Integration of mental health care into primary care. It has to come. Use of technology. We cannot have thousands of psychiatrists, but yes, we have technology where people have access to mental health specialists. Education and awareness is very important, and a primary target should be prevention, not on treatment only. Humanize data with personal narratives and real life examples. When I talk, be it a podcast or thing, I always give personal narratives and real life examples that makes people to understand, that makes people can relate and understand that yes, the doctor had spoken like this, and I had seen somebody in my family was behaving like this. this man must be suffering from some mental illness. So if you look, if you do narratives and give real life examples, people can understand much better, and communication is much better. Craft messages that blend emotion and evidence. It's not just emotion, evidence has to be there. Without evidence, science does not work. Make invisible challenges visible and relative. Just don't think that mental health is like this. It is a big thing. You just tell yes. What is the big thing? 20% of this has this. 10% of people with mental health issues don't get treatment. 2% of mental people with mental health issues are into serious problems. 25% have people. So you make it visible and relatable. So there is scientific data, narrative framing, make it emotional connection, and call to action. So novel research and treatment options are important. Increase accessibility, availability, affordability, and scalability. Affordability is a very, very important aspect, and scalability. Can it be scaled to a larger thing? Greater satisfaction through consumer empowerment. So these are all the aspects we need to look at when we are talking about policies. So data is a very important thing, and we in the subcontinent or the African continent are very, very poor in data. I think data is an important aspect when we need to translate it into, like I was talking about, you know, making the invisible challenges visible and relatable. That is where data comes into play. And once you have data, you can always talk about interventions. We can always talk about finances. You can always talk about funding. If you don't have any numbers, you cannot ask for money. And without money, nothing goes. So Tree of Life, a vibrant integrated system where me health is seamlessly woven into every aspect of public health. Lives changed, community strengthened, training programs, digital innovations, advocacy, knowledge, resources, partnerships are very, very important. And the implementation roadmap is train professionals, build capacity using WHO quality right standard, foster partnerships, collaborate across sectors for integrated mental health action, leverage AI. AI is very important tool, utilize innovative technologies to expand reach and personalized care, promote equity, ensure access for marginalized and vulnerable population, secure funding, mobilize resources guided by the mental health investment case. That's how we should implement it. I think I have shooted time. Sorry if hello.
No, thank you. You have done a great job, Professor Pachusi. So you may please stop
It
sharing.
was a little
So
tough
that
for me integrating thing. I don't know whether I've been.
no, you did a full justice. You did a full justice to this job, and I think I'm very, very happy, and I'm sure participants have enjoyed that as well. And so let's start with our panel discussion, because exactly at 7:30 the next panel has to start. So I'll give you 1 more minute just to relax,
No,
have
it's
a
okay.
bit of water, because I'm going to ask a lot of questions to you now.
No,
So
yeah, we have done a lot of policies. Like I just want to discuss one thing. During
yes,
COVID, I
please.
saw a lot of people from good families getting arrested for petty thefts, snatching.
Yes.
And then when we looked into it, I saw that they were having withdrawal symptoms of substance. Then I had a discussion with the police people. I told these people are having problems with substance. Why should we arrest them and make them into criminals? So
Yes.
we ran a campaign known as Dreams, where we never arrested people who did minor crimes for substance abuse. We put them in rehab centers. We counseled them. We took care of their withdrawals. We took care of the cravings. We built skills to them. We gave them places where they could do jobs. We gave them cards. No, we did a lot of work, and that was a brilliant project. I think it was not well publicized. Our media man did a poor job on that. We did such great work. So somewhere or the other, the government is listening to many of the things which you are telling. And if you are making the right noises, we are looking at primary prevention, where we are looking at reducing the whole impact. No, we can make a change. And now we are seeing a lot of de-addiction centers are coming up in Odisha. I'm coming, I'll be speaking from my experience in a place like Odisha. Even Punjab government recently have come out with 3 days back, they came out with a policy where they have called upon private psychiatrists to run government-run de-addiction centers. And in lieu of that, they're giving them money and also access to selling medications. there's a lot of problems in Punjab regarding medications, opioid, this
Yeah,
Udta Punjab.
yeah, yeah.
So suddenly the government has woken up to the fact that the government alone cannot do what it has to do. So it has to liaison with the NGOs, it has to liaison with public policymakers, make sure that policies are made, integrate it into the private setup also, and then a holistic approach, a holistic thing is being given. And I think that's where you all are so important. We as clinicians are
Definitely,
not too much into data science, the magnitude of the problem. I think hand in hand we can work together.
definitely, definitely. I agree with that. I completely agree with that. Okay, so we'll quickly start our panel discussion then, um, without wasting any further time, because your time is extremely valuable, and our next panelist would be joining any time after this. So I'll quickly go into questions. So please feel free to take time to formulate your answers and respond as you feel. The questions are very structured, but please feel free to answer flexibly. So the first question to you, Professor Patrujoshi, such a brilliant presentation, and the questions are formulated in such a way that they will complement with the presentation that they just brilliantly presented just now.
Professor
So
Maheshwar, your voice is not very clear.
my voice is not clear. Can you hear me?
It's breaking a little. And I think,
Okay. Can you hear me all right now?
yeah, now better. You're much better.
Okay. Yeah. Okay. Yeah. Because it was fluctuating, maybe. Okay. I'll put it this way. So the first question to you, Professor Patrujoshi, such a brilliant presentation. All the questions are going to complement the presentation you just made. First question is, why is it critical to integrate the mental health more centrally into the public health system and the policy communication and policy making? And what have you been doing so far? And maybe tell us a little bit more from your personal experience in the case of Odisha, as well as right now you're occupying such an important position. So, what are you doing in this?
No, yeah. If you look at the WHO definition of health, if you look at health, it encompasses physical health, it encompasses mental health, it encompasses spiritual health. It is not just the absence of a disease. So we are looking only the physical health. If you look at all the government policies, if you look at the preventions, if you look at the primary, secondary, or tertiary care, it is all about physical health. 50 years back, people used to work with their hands, with their legs, and they would have headaches, they would have, hand aches or something like that. But the current generation is all about this. We have a lot of things doing the physical aspect. It's all the mental aspect. And if you don't integrate the whole mental health, thing into the public domain, we are having a very, very people who are able to go to the gym and run 5 kilometers, but are not able to handle a simple thing as a simple rejection. Like somebody is telling that, no, the tea you served to me was little, had more sugar. They take it as a rejection. A simple task. People think that if I'm not able to do, what will happen? A simple friend telling you that you're looking little fat is taken as a very, very bad and negative sense. What I'm telling is, I'm not justifying somebody calling somebody fat. I'm just telling to the fact that we are not able to handle anything now in this world. If you look at our children, if you look at the adolescents, if you look at the adults, if you look at marriages, if you look at jobs, people have everything. Physically, people have everything. They've got houses, they've got cars, they've got money, they've everything. But what about the mental health? Are people happy with their lives? And that is where the mental health. Now, if somebody has depression, if somebody has anxiety, is the insurance people taking care of that? No. If somebody is depressed and he applies for a job, telling that I'm depressed and under medications, will you consider him for a job? If somebody tells, I was in a de-addiction center and I was getting treated for my alcohol related issues and currently I'm substance free, will you take? Stigma is attached so much because we are not taking care of mental health issue. And as long as the government does not come out and tell that, yes, 30% have depression, 22% have this, 2% of the population have schizophrenia. It's not as uncommon as you think. Everybody. So once there is like I'll talk to you about HIV now. Let's talk about something like HIV, which 10 years, 20 years back was the most dreaded, was the most stigmatizing disease. Now, if you look at the last 4 years, 5 years, HIV is curable, HIV is treatable, HIV is not looked at with stigma, HIV, just look at HIV of all the things. I want mental health to be like that. Schizophrenia, no problem. This medication will get okay. That acceptance level has to be there. That health seeking behavior has to be there. Somebody can walk into a depression clinic and take the medicines and tell hi and go back. He cannot come with a mask or tell me that let us have a video call. I can't show my face to you. I think that's where the policy is important. That's where the integration into the public health system is very important. Where every person is asked about his mental health when he comes to the clinic, government clinic. It's not just whether you have fever, whether you have anemia, whether you are having diabetes, you also having, are you feeling good? Are you not feeling anxious? Are you feeling depressed? Are you taking some substance? Are you hooked on sleeping pills? Are you taking alcohol? I think 7 questions. It gets integrated in public health system. So nobody is shy of telling that, yes, being anxious.
Definitely, definitely. I think that's something which I have been advocating for many, many years, literally all my life, because many times we just talk about physical health so freely and so openly and publicly that we feel ashamed even to discuss about our pain, our suffering, sadness, depression, any mental health issues that we may be facing. All of us face mental health issues at one point in time in our life. It's not like only few kind of people face that. And I think we need to popularize mental health and as well as mental wellness as a critical and inevitable component of public health system and public policy, so that it can be adequately implemented and people will start accepting it. The acceptance will come when we'll start integrating into the healthcare system and the public policy making in such a way that people actually start normalizing it rather than treating it as some sort of taboo subject. And that's where we need to head, and I think your responses are very vital in this. Okay, I'll go to the next question now. Question number 2 is, how are we doing as mental health professionals in terms of both prevention as well as interventions to respond to the increasing mental illnesses in India and globally, and how can we play an instrumental role in changing the attitude towards mental health and the treatment for seeking mental health?
First part of the question I just could not hear. There was a break involved.
How are we doing as mental health professionals in terms of both prevention and interventions to respond to the increasing mental illnesses in India and globally? Uh, and how can we play an instrumental role as mental health professionals, basically, in changing the attitude towards mental illnesses?
Thank you so much. I think our role is multifaceted. Now, first of all, we need to create the resources. Because with
Yes.
time, the awareness is increasing. Now, people are asking me, is mental illness really an illness? How suddenly a lot of people are coming, you look at people's Insta post, people are anxious, people are depressed, people are having PTSD. Why in our times, 5 years, 10 years back, this was not there? Somewhere or the other, the brain is changing. The diseases that were occurring 20 years back are not occurring now. So now mental health issues are on the rise. So number one, we need to create. Now, like I believe in teaching the undergraduate students. Suppose I have 150 students. After 4.5 years, I want that 150 students to know the nuances of mental health, to know the common mental health issues, to intervene in the early part. I don't want them to take care of the patient only. But when a patient comes to us, they should be able to identify somebody is depressed or anxious or having a substance issues or schizophrenic or having a personality issue or is having excessive cleaning or a child is having autism or a child is hyperactive or a child is having mental health issues or maybe a learning disorder. 10 to 12 diseases, I think everybody should have a common understanding how to identify, how to intervene. It's very important because they are going to the grassroots. We need an approach where from the tertiary center, we need to go to the tertiary, to the primary people. And once we have a set of people who have the skill sets to understand, then the treatment parts come. Now coming to the prevention part, I'm talking that we need to catch them young. The
Yes.
parents have to be taught how to parent, the languages they use, the communication skills they need, what is, and a very important aspect of that is digital, hygiene. We give our children mobile from the child is 1 month or 2 months. The child before he can hold a pen knows how to swipe left, right, center. We see a lot of people now having digital addiction in terms of mobile addiction. And it's an epidemic. I'm telling you, it's an epidemic. Watching reels, watching
Right.
nonsense. The content they're seeing is very, very bad. People are going into
That too
whatnot.
for
And
several
ultimately,
hours, several hours without any
it's not
break.
several hours. It's 10 to 12 hours a day. And I am seeing 10-year-old committing suicide because their mobiles have been taken away from them. That's how the whole algorithm has been built like this. The moment they need dopamine every second. I'll tell you a simple story. When Ramayana was going or Mahabharat was going 25 years back or 30 years back, we used to wait 1 week to see one episode. Now a series run, people watch from 10 o'clock to morning 7 o'clock and finish it. The dopamine needs to be given every 10 minutes, 5 minutes, 2 minutes, 3 minutes. Now we have short reels, series where 30 seconds or 2 minutes episodes are coming. And the moment you take away the mobile, the dopamine surge is not coming. There's strong withdrawal. And then they become suicidal. Now, why do you see a lot of young people committing suicide? And it's a epidemic now. So primary prevention has to be there. Digital hygiene is the most important thing. I think mobiles have to be banned. We need a policy where social media has to be banned before the age of 10 or 12 years.
It's
We are
banned in a few
normalizing a lot
countries.
of abnormal behaviors. And I'm telling you, one of the primary prevention has to be digital. People are getting into betting, people are doing sexting, people are doing multiple things. A lot of people are sending, sharing inappropriate thoughts, and they're being blackmailed, they're being abused, and that's taking a toll on our children. And it's not just about depression, anxiety, it's all about these things. Now, teaching children how to handle disappointments, how to handle rejections, how to handle failures. People are feeling valid, they feel that they're entitled to everything in life. Nuclear families are not making the children responsible. They are
Yes,
just giving things to children, not making them accountable.
yes,
People are just there's a sense of why should I live? Now, if I put all my eggs in one basket and the basket breaks, I will now ask why. The existential crisis, very, very important aspect we are seeing in our children. We need to make them more responsible. We need to make them live for others. They're living only for themselves. And these things have to be integrated into the education system. Education system is not just about maths, physics, biology, chemistry. It's also about resilience building. It's also about coping with failures. It's also about how to get back on your feet. It's about, a lot of things are there. That's where the education system needs to be. When it comes to colleges, people get sudden independence without responsibility. And that's where we need to teach them how to handle peer pressure, how to handle relationships, how, when you are feeling depressed or suicidal, how to manage it, how to communicate your emotions properly, and if they are communicating, how the other person handles it. So a lot of gatekeeper training we are doing now. Okay, students will take care of their peers' mental health. Teachers need to be the primary mental health care provider, not the doctors. Counselors has to be there. They have to be very, very non-judgmental. They need not look down on people who are vulnerable to mental health issues.
yes.
It's our duty not to treat every child as same. It's a duty to make every child on an equal term. That's what is equity. For me, every child in the class is not equal. My duty is to
Very true.
make them equal. That is how equity has to be built. That's where we need to drive. Policies have to be made where mental health, budget for mental health has to be there. Every school needs to invest in a few counselors or therapists or somewhere. Every child should have minimum in a one session with a counselor where he or she can discuss what is happening, what is not happening. If nothing is happening, it's good. If something is happening, we will need to handle those things. Confidentiality is a very, very important aspect which we should have. If somebody comes to us in confidence, we need to keep that in confidence. It should not be a gossip or it should not be rumor. So money is important. And the whole, the collaboration with the NGOs. The government cannot reach everywhere. I think the policymakers has to, be in consultation with the stakeholders of
Yes,
mental health. And that's where I think policies need to be changed. We need to, make sure that everybody is in the decision making, everybody is in the action, and everybody is benefited by it. The whole sum is that.
in some
So
countries
treatment,
they have. Sorry, you saying?
and treatment part, yes, we have become much more focused because initial maybe 20 years back, the only focus of treatment was to make them away from society so that they are not a hindrance to society. Now our target is different. We want to reintegrate them into society, and the targets are now that they are as equal to us, the people without mental illness. So medications have improved, treatment modalities have improved, treatment targets have improved, and now I
Yes,
think the results are much, much better.
definitely.
And
Even
if you
I
give good
agree.
results, Maheshwar, if you give good results, if you make them, what happens is when somebody comes back to the village, he had gone out with a serious mental illness. We have treated him, he's reintegrated into society. People look, I always tell to people look at the results, people look at
Yes,
the products. And if you're able to give good results, then the awareness improves, then the stigma reduces. And once it is integrated into the public health system, like we have the Pradhan Mantri, we had the Biju BSKY here, with the Atal, there the mental health is integrated now. Now we can give ECTs, we can give treatment. So once the cost to the individual reduces, the stigma reduces. Because mental health is a sometimes very chronic illness. It is not that you buy antibiotics for 5 days and it's over. It's not like that. And if you spend money and if you can't reintegrate them back into society, the stigma will increase. But you're able to get them on track with less expenditure, and they are able to earn. The stigma reduces, the awareness improves, the health seeking behavior improves, and ultimately it's a win-win situation for everybody.
yes, definitely. I think you have answered many questions which I wanted to ask already. But anyways, let me go quickly into my structured question. Okay. The next question is, how can we move beyond institutionalization of mental health to community-centered and community-enabled mental health and wellness initiatives? And what's your experience in this?
The time of institution is over. We have 4 or 5 institutions that were there and that is there. That is not, if you look at India's population, it has increased by leaps and bounds. If you look at people with mental health, it has issues that has increased. If you look at people who can pay money, that has increased. But the institutions have remained as they are. Now, what is happening is because of the awareness which we've created through the media or through movies or through series, people are coming early to us. Now, when people come with a very, very serious mental illness, they have to be institutionalized because there's less support system. But now, when people come early, and the interventions have improved significantly, and if you look at the healthcare systems in the country, it has improved. If you look at postgraduate, 15 years back, we had only 2 psychiatrists coming out in Odisha. Now we have 40 psychiatrists coming out of every year. So the number of psychiatrists have increased. Yes, we have a dearth of psychologists. I think clinical psychologists we need. Psychiatric social workers we need more. Nursing, psychiatric nursing we need. These three are the pillars on which the whole system works. We are having a top heavy, system, and the pillars are weak now. So I think the interventions, we need to create more resources when it comes to nursing, when it comes to psychiatric social workers, when it comes to clinical psychology. That's where I think the impetus is, because gradually a doctor cannot be attending every patient. We need a tire, and the interventions cannot be just based on medications. Interventions has to be on therapy. Interventions has to be based on families. Interventions has to be based communities, and that's where these people can help. So reaching out to the community, it has improved, but there is still a huge gap between the requirement and what we are doing. Telemanas is something which has helped a little. There's a telephone, you can, what happens is suicide is not something somebody is feeling every time. If you look at 100 people who commit suicide, 90% of them are not suicidal 24 hours. They're good, they're managing well, and suddenly that impulse come. And at that moment, if they have somebody to talk to, who can handle that 30 minutes or that 1 hour, we reduce the number of people who are attempting or committing that. So crisis intervention is a very important aspect with the telemanasis doing. India is a huge country. We are trying out things. That's very important that you need to try out things. Everything should not be result oriented. A lot of things which is effort oriented. And that's where the research is important. What interventions help? And reaching out to we are doing a lot of community now. A lot of people are going out to communities, going out to cities, tier 2 cities, tier 3 cities, going to middle level people areas and practicing now. But I think the district mental health program needs to be implemented. Except Karnataka or 1 or 2 places, we are not doing much about the district mental health programs. I think that's very important that we need to ramp up the efforts when it comes to the district mental health program.
Right. Okay. Means associated with that point that you just made, Professor Pratijoshi, the next question is, how should the interprofessional collaboration goals align with effective and evidence-based mental health service delivery in India? What's the role of psychiatric societies and professionals in enabling equitable spaces to other professionals such as clinical psychiatrists, psychiatric social workers, and psychiatric nurses, etc.?
I think that's a very, very controversial thing you've asked me today. Why controversial? I'll tell you. What is happening now is that we have a lot of people, untrained psychologists, who are, presenting themselves as trained people. Now, I have worked in an institute where we were in absolute perfect sync with the clinical psychologists and psychiatric social workers because they were trained. People who are educated, who are trained, know where the lines are, know where they should intervene, where they should not intervene. And a lot of people who are masquerading themselves as clinical psychologists, as therapists, know nothing about the
Yes.
subject. They're coming on Insta, quoting things, and somebody who needs medications, they're telling, what happens is when you tell to people that you try. Now, I have a broken leg. I have broken my leg into three pieces and I can't even stand. Now you tell me to run and I'm not able to run. And you tell me that you do this, you can run. And then when I can't run, you tell me that you are not putting too much effort. Then there's a sense of helplessness that no, I am not able to do things because the interventions are not right. The outcomes will never be right.
Yes.
I have a broken
Correct.
leg. Either I operate it or put it a plaster under it and put it for 6 weeks and then tell somebody after I take off the plaster, now you start walking, just putting your feet. That's how systems run. And if you tell somebody who is severely depressed not to take medications and tell that you do yoga and you will heal, it's not that. And the person is repeatedly trying to do yoga and is not able to get any result. He thinks the advice I got is the best advice, and then he feels helpless and he ends his life because he's not improving. I think the integration, respecting each other is very important. And wherever we
Right.
work as a team, the outcomes are much, much better. You look at something like a OCD. The OCD medications work very well. Therapy works well. But if you integrate medication with therapy, it works wonderfully well. Now, somebody is depressed or somebody is taking substance because his partner is creating a lot of havoc in his life. He's not able to cope. And we are trying to treat him, we're giving therapy, but not able to take care of the partner. There the psychiatric social worker gets. Now we have family which is in a joint family. It's very, very enmeshed. There is no boundaries. People are stepping into each other's legs. There we need a psychiatric social worker. Now we have kept somebody in a hospital and the nursing care is very, very bad. People, the nursing, we cannot. So I think every aspect, all the four elements are very important. It's like a well-run car. The tire is important. Nothing is more important than the other. Everybody has their roles. If we
Yes.
look at our roles, if we know that yes, this is what we have to do, no work is big, no work is small. But don't step into each other's legs. That's the only
That's
thing I
very
would.
essential. I think people need to acknowledge that more often than they do. So that will make the job much easier and better and more efficient. Okay. The next question is, how can psychiatrists play a leading role in effective science communication to policymakers, community members, as well as to civil society? I know you have covered a bit in your presentation,
No,
but I would like
I,
you to.
I tell to people that we need to come out in the media much more. We need to talk because one of the important mediums of communication now are the internet, the YouTube channels, the Instagram channels. People watch, you have to communicate effectively now in areas where people watch. And the most important, easiest method to reach out is when suppose something happens in the public spectrum. Suppose I'll tell you, let us talk about suicide, Sushant Singh Rajput's suicide. The thing that brought the nation almost to end. And unfortunately, what happened, I'll tell you, because of the Mental Health Care Act, the people who knew about him were not able to speak. And the people who knew nothing were able to create a narrative about something or the other happening. And when I
Yes.
posted something, because I knew a lot of things, when I posted something that Ria was not responsible, I'm coming on record and telling you this.
Yes.
And somebody had mental health issues, and because of this, he or she did this, people just put us down. So whenever there is an event and we can relate it to the mental health issue, it will be easier for people to understand what is happening, like a murder, like a suicide, like why somebody has done this, why somebody, so that's very important that we come on air, and speak. Speak in a common language. Let's not be very, very scientific. Let us integrate this science and evidence and make it simpler. The best people are who know a lot of complicated things and make it simple. And there is a one set of people who know nothing much, but they'll make it complicated and pleasant. And I think our duty is to simplify things and tell to people the way they can understand and make it very solution focused. Okay? And the solutions have to be very tangible. Some things which we can do. I cannot talk about in India what is happening in the United States of America. I need to understand that India is a place where social supports are much better. We are not institutionalizing people. We are not stealing children from the parents because there is some issue in the house. We can't do that because we don't have places where we can keep the children safe. I think children will be much more safer in a place at home until unless the things are very serious. Because one of the parents must, in a Western country, one of the parents is not staying, the other parent is abusing. It's different aspect. India is not like that. So based on the culture, based on the regionalism, we need to intervene. We need to create interventions in that manner and simplifying things. Community is very important when we go to the stakeholders of the community, these seniors, and talk about how stigma can be reduced, how we look at somebody with mental illness, how we how do we incentivize people who reach out for help? Now, somebody has a son who is absolutely abusive, assaultive. If the parents, parents don't come out. I had somebody who was holding two guns. He was psychotic, he had a Mauser and somebody, he had a license. And we had to intervene and tell to the police that please take away the guns. I have picked him up and kept him in an institution. I can keep him for 15 days, 20 days. But once he gets out, he has a license. He might kill me because I have picked him up. So somewhere the licensing is very, very important. We reaching out and we not taking, India is a place, I'll again tell you, there are a lot of demerits in terms that we are very, very close with our blood because it is blood, everything the blood does is right.
Yes.
And that needs to change. We need to inform, then early interventions can come into place.
That's true, very true. I agree. Okay, great. I think the point that you're putting, Dr. Patayoshi, they're a little contentious, but they are necessary to be pointed out. Okay, I'm going to another more contentious issue, which is a globally contentious issue today after Trump came. How are Indian mental health professionals working towards including equity, diversity, and identities into the mental health professional education and service delivery?
I'll tell you something, Maheswar, it is, I don't know, but the whole policy of, and we're looking at LGBTQ, let me be very specific now. His approach to LGBTQ is a very, very inhuman approach. And our leadership was also being little, more towards Trump's policies than what it was. I think somewhere people are afraid of what might happen because people have relatives living in US. Now everybody is looking at the social media. There's a sense of fear. And I don't know. It's really inhuman. It's really cruel. It's really horrible, but we are there. We are in the top tier of the policy making, and we make sure that nothing that we have stood for changes. Sometimes you need to be a little quiet. Sometimes you need to just be not on the back foot, but stay where you are and make further progress once it's little more times are little better. But times will always change. What goes up comes down. What goes down comes up. And as long as you're fair, as long as it's honest, as long as you don't have to go up or down, you're walking in a straight line. And I think it's a little sad. I'm not able to speak a lot of things because I'm in the policy making of the society. But yes, we have been told that be quiet and do your work. Don't have to display too much of advertisement. But sometimes people go overboard. So we have been directed not to go overboard. Do whatever we do silently behind the screen and work on whatever policies we have been fostering. We need to continue that. That's the assurance I give to you today.
So it means like we are staying firm on our principles and our overall.
We're not just going overboard. Like we had subcommittees on LGBTQ. We have not done the subcommittee, but I'm always working on that aspect. Because they told me that you are the secretary, you can do whatever you want. So let's not have a formal body and you do what you want to do. That's good enough. For me, that's good enough.
Okay, At least they are responsive to the need, which is essential.
No, I'm part of the leader. I'm the second most
Yeah,
powerful.
yeah,
So
definitely, definitely. So that's actually very encouraging and heartwarming to note that. So that brings me to the next question: how should mental health professionals position themselves so that mental health occupies a well-deserved central position in all health policies? And what's their role in shaping the national and global health policies? Especially, I'm asking this question as a mental health professional based in India.
So what I mean to say that every psychiatrist has a important client, a politician or an actor or somebody. Now use them. I tell them use them to advocate for mental health. They're the important aspects where we need to position ourselves as that mental health is so important. We treat a lot of children of very, very important personalities, and they always want it to be hidden. They want it not to be displayed. So we need to put pressure on the government. We need to create. I told you, no, data is very important. We need to
Yes.
throw data on their face.
Yeah. True.
And as
Very
long we
true.
don't do proper good research, as long we don't talk about interventions, as long as we don't talk about just making an immense or one or two institutions and putting all the money there,
Yeah.
I think that's one area where we are in fight with the government also. That don't put your money on all in one aspect.
In fact, I have been arguing about that in about many other elite institutions in the country. Like IIT is
Putting
taking
all your
away.
money in and most of the people are only doing research on paper and pen. That's not actual data. Why? No, suppose I see 60 patients a day. Why will I listen to somebody who sees 4 patients a day? You get
Right.
the point. So
Yes.
somewhere the data has to be convincing, the data has to be authentic, the data has to it has to be real time and real life scenario data. I can relate to the data that is being given to me. Then I'm working so hard. I know what is I might have not have the numbers, but I need the numbers to throw at the government. I need them to make provisions in the budget which is equitable. I need everybody to be a stakeholder in mental health. Every individual can be a stakeholder in mental health. He cannot treat, every person can do a counseling. Everybody cannot treat a diabetes. Everybody cannot treat a hypothyroid. But everybody can intervene and take care of somebody's mental health. Every one among us is a mental health professional.
Yes. I
So
agree with that.
as long and I always tell people fight with me. Why are you advocating? Why are you advocating? I tell mental health professionals have to be advocates.
True.
And the number one quality of a mental health professional is you have to be a leader. You have to be an advocate. You will create negativity. People will not like the way you speak, but it's very important to stand up and speak because I am not running a popularity contest. I'm doing what I think is right for society. And that's what counts at the end of the day. When you sleep, you should understand that yes, I have done something beyond myself and my family.
True. Very true. Okay. I go to the last two questions. Can international partnerships advance mental health advocacy more effectively? And how are the Indian mental health professionals playing a role in this regard?
I tell you, we had this Mental Health Care Act, which was aped. Uh, the society was little, in the back foot when the Mental Health Care Act was done, and they gave it to one NGO who just copy pasted what was happening in UK, and the whole way we treat mental health patients had changed. It is horrible. If the laws are implemented the way it is, all the psychiatrists will be in jail.
Mm.
So the society plays a very important role. Now, I am been very proactive in liaising with the government. Whenever a letter comes from the government, even if tomorrow there is a meeting, I catch a flight and go and attend the meeting and come back. Nowhere I will go unlistened to. I make documents, I send documents. I make documents immediately, I mail it to them. I am part of every policy they try to make. If they've called us, we are there. We make sure that we will not complain today that the government did not consult us. Wherever there is a consultation, and now talking about internal things, the international things, there are a lot of good things that is happening outside. There are a lot of bad things that are also happening outside. If you go to a place like New York, if you walk the streets of New York, every 10th person is a mental ill individual. India, it is much, much better. We have a policy where we can pick up people and treat them that they don't have. If somebody does not want treatment, you cannot treat. And those policies are a no-no in a country like India. Because a right of an individual is not just his wish. The right of an individual is what is best for him. And 99 out of 100 times, we can understand what is best for the individual. An individual with a serious mental illness does not understand what is right for him. So, international collating is very important. But there are a lot of structured things they bring into picture, which in a place like India we cannot. So we can ape some of the things that they bring. We can mm, regionalize it. We can make it culturally appropriate and build on those things. So I think integration and it's not that we copy paste things. We look at the systems that are running. We look at the policies that are running. We make sure that we try to, you know, do some research on certain pockets, understand what are the results coming out, tweak it a little, delete some part, add some part, and then maybe take it forward. I think for that, we need people who are good in data, the data scientists, we need good researchers, we need, I think the clinical part and the research part has to be integrated much better than what we are.
True, true. I
People
agree.
like you should take our help to get better data and reintegrate it because we are sitting on a lot of data.
Definitely. Okay, so the last question, which is for our young researchers and participants who are present here. How can the young and early career professionals in various lower middle income countries become more effective mental health advocates in their own countries? What will be your advice to them?
I think you need to understand that the policies, like a place in Sri Lanka. I just give an example of Sri Lanka, where the LGBTQ is not something which has been approved. I talk to a lot of mental health professionals there, psychiatrists. I tell them, why don't you call me? At least I will go to psychiatrist and teach them certain things. We can integrate that this is what is happening in India. Some people, it's more friendly. Somewhere it is less friendly. Look at cannabis now. In some countries, it is legalized. In some countries, it is not legalized. So you need to understand the culture of the people. You understand what is happening around the world. You need to read up. You need to understand the needs of the country. And then maybe you have a line of thinking. And I think you can write your opinion pieces in good journals based on scientific evidence which you have, liaison with the government. And I think the best way for advocacy now is to be on the internet. I think YouTube videos, I think small reels somewhere goes a lot in changing the perception people have about mental health issues, how they look at people with mental health, the resources they need to invest in mental health, the evidence or the data which is people don't know about. And if you can relate it with what is happening in the society, people will naturally, the eyes will open. And somewhere, some place, the government is also a lot of money with them. They only need an approach. That you need to somebody to tell them that yes, this is an important area. It's as important as a COVID which you're looking at, which has only taken away this many lives, and it will never ever take that many lives again. But mental health, every day it is killing people. Every day it is, making somebody more vulnerable to certain illnesses and reducing the longevity of life. So
True,
we just
very
should
true.
not add years to a life. We should also add life to our years. That's so important. So mental health is an important aspect.
So your advice to them is basically to become health influencers, but using evidence
Yes.
and become more better mental health advocates.
Yes.
Okay. With this optimistic note, I think it's time for me to say that we are indebted to you, Dr. Patishi, for coming on board today and spending an entire Sunday evening with us on the platform of Global Health Forum as well as Global Consortium of Global Health Actors, Leaders and Thinkers. We are very, very proud and privileged to host you. I would like to inform you that this program, that is Advanced Certification Program on Strategic Research Collaboration and Communication, is being attended by more than 800 plus participants from 100 plus countries, and more than 300 participants are research active. That means they are attending their research module, they are working on their
Today,
individual projects with us.
Maheswar,
And
today's attend by 200.
yeah, today they are attending live because they are based in different parts of the world. But there are more than 800 participants with us, and more than 300 participants are working actively with us on their individual research projects as well as group projects. So it's a very intensive research training program. It's the only one of the kind state-of-the-art training program on strategic research collaboration and communication running anywhere in the world, and it's a completely freely deliverable program. And we have speakers coming from all the top institutions in the world, as it was told during the introduction section. So in the tradition of our advanced certification program, all the resource persons who come to teach and deliver lectures during the 12 weeks of the training program, all of them will actually pen down their signature for a certificate program, a certificate which will be provided to all the participants at the end. This certificate will be known as Statement of Higher Education Achievement. This particular certification is provided in the format of UK and Australian higher education framework, and this certificate will bear your signature, all the signatures of all the resource persons who have come and taught them, whoever they come from wherever, and this certificate will be given to you, given to the participants in addition to the certificate of completion as well. So this is a very specific statement certifying that you have been their teacher, you have mentored them, and I think this is a very relevant document. So I hope you will be very kind to provide your signature on Hazel. The admin team will be in touch with you regarding this purpose after the completion of today's panel. And we'll also like to inform you that we do not have a lot of money to provide you any souvenir, physical souvenir or anything, but we would be very happy and I would be very honored to provide you a certificate of appreciation from the Global Consortium of Global Health and the Global Health Forum, and we would be emailing that to you upon the completion of the plan tonight. And with this note, I hand over the mic to Mr. Faisal, admin, to do the news. Thank you. Faisal, over to you.
Thank you, Professor Satpathy sir and Dr. Amrit Pattajasi sir for such a compelling and enlightening discussion. So we will now take a 5-minute break and return shortly for our second panel that is to be starting on just after these 5 minutes, and our esteemed guest is already present here. So participants, please be on time, and after 5 minutes we will start.
Yes, exactly. Okay, Dr. Pattajasi, thank you. I'll be in touch with you personally. Thank you. Have a great evening. Okay, so participants, please stay on board. Do not go away anywhere. Please use this time to for restroom break or some fresh air. And our eminent panelist, Professor Tiwari, has already joined us. So you can now make him the host, Faisal, and we can start after this. Okay, I'll go for a break. I'll come back in 2 minutes. Thank you. Okay, Faisal, can you hear me?
Yes, sir, you can hear.
Can you please promote Professor Tiwari into host?
He was present here, but now I can't see him.
Okay.
Maybe he got disconnected.
So I'm putting a message. Can you please give him a call? No, you don't have his number. Yeah, I have messaged him. He's online now. Yes, Professor Tiwari has joined, so please, yeah, great. Okay, so good evening, everyone. We had such a powerful session. I think we just enjoyed it. And after this, we all will get 2 minutes of break and meditation. Such serious, important issues. Hello, Professor Tiwari. How are you? I hope you're
I'm
able
well,
to hear
thank
me.
you.
Your voice is a bit feeble. Can you please check?
I'm well, thank you. Can you hear me now?
Yes, I can hear it, but maybe if you could improve the audio a little bit more, like sound, maybe that will help.
Hello, is it
Yes,
okay?
perfect. Yes. Okay, so let's start. Participants, I hope you're all ready. You got about 5 minutes break. Now let's start since we are running a few minutes late. So it's better that we start as soon as possible rather than wasting any further time. So over to you, Faisal, to do the news. Thank you.
You very much. So now we are beginning our second panel discussion titled Envisioning One Health Research and Policy Advocacy Network in Asia and the Pacific, Dogs, Humans, and everything in between. Joining us now, Dr. Harish Tiwari, founder CRE India, Inspire Faculty, IIT Guwahati, DBT Welcome Trust India Alliance Fellow. Moderated once again by Professor Maheswar Satpathy, CEO Global Alt and Director COE ECCPH India. Professor Satpathy, we invite you once again to introduce Dr. Tiwari and open the door for this critical One Health discussion. Thank you very much.
Thank you, Faisal. I have the distinguished honor of presenting and introducing Professor Tiwari. Professor Dr. Harish Tiwari is founder of CRE India. Uh, Dr. Harish Tiwari is a veterinary epidemiologist with expertise in implementing evidence-based solutions to prevent, control, and eradicate animal diseases with a unique background that blends strategic thinking from his years in the Indian Army and the academic acumen earned through scholarly achievements. Dr. Tiwari uses his epidemiological analytical abilities for finding solutions for animal diseases at herd level. Dr. Tiwari is particularly committed to advancing One Health's approaches, particularly in the context of dog-mediated rabies elimination in India. Dr. Harish Tiwari is currently leading the Welcome Trust India Alliance project as an intermediate fellow and an Inspire faculty at the Indian Institute of Technology Guwahati IITG. The project aims to eradicate dog-mediated rabies through the One Health strategy. Previously, Dr. Tiwari has worked with the Asia Pacific Consortium of Veterinary Epidemiology (APCOV) at the University of Sydney as a consultant with Oshvet Private Limited and also as a commissioned officer, that is Lieutenant Colonel, with the Indian Army. He has commanded Army dog units in various field locations across the country. Beyond academia, Dr. Tiwari has also been a consultant in veterinary epidemiology for international agencies such as World Organization for Animal Health (OIE) and the Clinton Health Access Initiative (CHAI) on projects related to disease surveillance and antimicrobial resistance. His leadership roles extend to international collaborations, including projects focused on One Health laboratory networking in Southeast Asia and addressing antimicrobial resistance challenges in the region. As a keynote and invited speaker at prestigious conferences and webinars, Dr. Tiwari shares his expertise on One Health strategies and the imperative of eliminating dog-mediated rabies in India, inspiring a new generation of researchers and practitioners. Dr. Harish Tiwari is passionate about serving the cause of rural farmers to empower them by providing top-class epidemiological solutions. His commitment to animal welfare, especially of free-roaming dogs, is undiluted. And with this very generous and very small introduction to talk about a tall figure like Dr. Harish Tiwari, I would like to request him to kindly illuminate us with his perspectives on One Health and how we can make it a reality in India and the broader Asia and the Pacific. I'm sure our participants would learn a great deal by your presence and your words of wisdom, Dr. Tiwari. So over to you. The stage is all yours. Thank you.
Yeah. Thank you, Professor Satpathy. Can you hear me? Can everyone hear me? I'm properly audible. Yeah. Yeah, yes. The introduction was really very generous, and in no ways it was small. I think it said things beyond what I'm capable of, and I profusely thank you for that. The topic given to me, it actually requires a blend of so many things. And as I think I may not be that skilled and I'm not master of that many domains, but I'll try to do my best. Um, Basically, I have worked. Very I've been very eclectic in places I've worked, the things I've done. So I would not call myself as a scientist or a man of science. I am basically a storyteller. I just use science to tell my stories. And I believe after that heavy duty session that you had just preceding, and if the people who are listening to this presentation or the discussion, panel discussion, are the same people, I think the previous session was very heavy duty. So I'll go a bit slow and will enjoy this. I'll try to make it interactive so that we just learn the basics so that we can take off from there. Okay. So if it is okay, I will share my screen. Yeah. And
Horrible.
yeah. Okay. 1 second. Yeah. I will share my screen. And before I go on to my presentation, I would like to know what you think about One Health. And for that, I have organized a game for you. Okay. Can you see my screen?
It's coming up. It's not yet. Yes, now it's on. Yeah.
It's on?
Yes.
Yeah.
Okay. Oh,
Yes. Yeah. So there is a pin. You can go on to www.kahoot.it, or you can take the QR code and punch in the pin there and don't give your true name. You can give any name, and you will be on to the Kahoot, and then we will see. I can see how many people are there. There were about just short of 200. Um, you have to be a little faster because the capacity is only 200 that I can accommodate. So if you can make it fast, we can do it faster, and then I can start my first question, knowing where you are with the understanding of One Health. Yeah.
they are from several countries, by the way. Um,
Oh, yeah, yeah, yeah. Yeah, you can give your own understanding. I have been conscious of this fact that my audience comes from a variety of regions and continents. So we will keep it that way. We will not keep it very focal. But I would like that everyone should think about the region they are inhabiting. So when the problems are put up, they can think in their own context what would apply. Okay. So I've just got 27 people. I'm just waiting for more.
Okay, you are very slow, guys. You need to
Yeah,
be
it's
quick
not
enough.
all that tough. It's not
Yeah,
very
just
tough.
put your name. Just put your name. I think that's what Dr. Tiwari is asking you to do.
Yeah, you don't have to put your name, just put anything. Yeah,
Okay,
yeah,
okay,
so that you identify who you are.
yeah.
Maybe, yeah.
But don't be shy, okay? Yeah.
Yeah, nobody
This
knows who's answering whom. So, yeah, that's all right. And it is not a test of your knowledge. All through, we are making it interactive so that I also learn from you. I understand the gaps. And next time I do this thing, then I'm able to web up a better story. So that's my intention. So only 36. Okay, we'll give another 20 seconds and then I'll put up the question. Okay, so here goes your question. So that's my topic of the game. You don't have to answer anything here. This will answer in a word cloud. And my question is, what comes to your mind when you hear One Health? And you can just type your answer, anything you feel like. You think animals, you think humans, you think grass, you think hen, you think dog, you think what? Whatever you think, please type your answers. Okay, so now you can see the word cloud here. All living things, animals, physical, mental well-being. Somebody wrote that and cut that. I mean, that is included in One Health as well. Okay, somebody just thought of cat. Very interesting. Fitness, yes, fitness for all, for a fitness for the planet, maybe. Okay, you don't know. Okay, you are my best candidate. Somebody said don't know. Yes, we will learn with you what is One Health. Okay, yeah. Let us see how it looks like. Okay, so this is what we got. You can keep answering. I'll stop share and start with my presentation. So you can get an idea, even though people who did not participate, what people generally think about. So there is a word environment which comes, I think, twice. There's a lot of human, animal, and environment, and there are a lot of animals all in one. That is good one. But the maximum thing is animal, human, and environment, which is very interesting. So I'll stop share here, and now I will share on and keep your Kahoot on your mobile phones ready because there'll be more questions coming. And in the meanwhile, we go on to our presentation. So can you see my screen now? Can you see my screen? Can someone please confirm?
Yes, sir.
Okay. And can you see the slide mode? Yeah. Okay.
Yeah.
Okay. So this is the topic given to me. And before I go on to that topic, I would like to narrate a storyteller that I am. And this story is a very old story. You can find it on YouTube. Probably I have given the link later, but you can find it out. This is a story which happened in 535 AD. So what happened was in a place and in Indonesia, there was a volcano which exploded, and this volcano was called Krakatoa. And the volcano was so massive that all that lava that came out, it got spread all over the world. And there was darkness for months and years together. The summers turned into winters. The crops stopped. And there was a lot of devastation, human deaths. And that smog that spread all over the world, it affected all the continents. And they thought that this is a natural calamity that just is affecting the environment. But something else was happening far off in Africa because of this volcano. With this flea, there is a flea, Tinocephalus tree, then flea, which feeds on uh, uh, rat blood. Okay, and the rat contains a bacteria known as Yersinia pestis, and its alimentary canal was very open, and the Yersinia used to pass down the feces, and nothing used to happen. But because of the cold that happened because of this volcano, the alimentary tract got constricted, and the Yersinia remained on the upper alimentary tract. And because of that, the rats, who harbored this bacteria, then this flea also bit the human beings, and that's how the human being the bacteria was transmitted to human beings, and that's how the first kind of plague appeared on this earth. And when this was appearing and this was happening all the way in Africa, there was this ivory trade which used to go on between the Roman Empire and the Africans. And this Yersinia pestis, or the infected rats, they got transmitted all the way to Europe through the seaway. You know, while this was happening here, there was something else happening in Central Asia. Again, because of this cold weather, the grass blades got very thick, and the Mongols, who were contained in that area and who were the best horse riders, suddenly found their horses to get sick, and they were not able to use them properly. Their feces became too tight, and they suffered a very common management problem of equines or horses called colic. And that is why that forced these Mongols to move towards the west, to Europe. And that was how, after 200, 300 years, this movement of Mongols towards the west, that struck the last blow to the Roman Empire, okay, around 800 AD. And there was only there was a route of, there was one branch of this Mongol people who also turned halfway towards India, which later gave rise to the Mughal Empire in India. So this is the story, how just an environmental calamity caused a disease, in animals, and it made political changes. It made economic losses, you know, and this all happened because there was a disbalance in how the earth was moving. So this is one of the classic stories where the environment caused the one health damage. Okay. So now, after this, I would like to again ask you, again do the same thing. And now you tell me what comes to your mind when you are thinking about One Health. Okay, you will get the question there. So what comes to your mind? This time I have given you options. So think of that story, and these are your options. Can you see the options? Professor, can you confirm? Okay.
Yeah, you can see. Please be fast. seconds, 3 seconds. You have given them very little time.
Okay, so
If
okay. So just be fast on your fingers. So there were 10 people who thought very correctly, 36% who thought that it is a connection between humans, animals, and the environment. However, other things are not exactly wrong. They are also part of One Health. And that is the beauty that solves the mystery of One Health, that it is actually a combination of so many things. Okay. So now let's go back to our presentation. And now I will not do many stops. So let's go back to our presentation straight away. So can you see the screen, please? Yeah.
there any issue, Dr. Tiwari? The screen says stopped.
Yeah.
Okay, now it has started.
Started now?
Yeah. Not up
Okay.
yet. Yes, now it's up. Yeah.
Yeah. So you can see the presentation mode. Okay. Yeah. Can you see it now? Okay. So the topic was envisioning One Health research and policy advocacy network in Asia and the Pacific. And we are supposed to discuss everything between dogs, humans, and whatever comes in between. So as I already mentioned that I'm not that erudite. So I will try to tell you, give a brief about what One Health is. We'll talk a little bit about the research. We can talk about my experience in One Health research, policy advocacy, a little bit touching there, and what is happening in Asia and Pacific and why Asia and Pacific is very important. We will also talk about dog because I'm very fond of talking about dogs. I'm passionate about eliminating rabies in India, so and elsewhere, everywhere. So my research, half of my life has been devoted to that. So I'll be very happy to talk about dogs and then what is their relationship with human beings and everything in between. So to be very concise, we will understand One Health and then we'll see how this One Health can solve the health security challenges which have been knocking our door or maybe breaking our door too much last 2 decades. And then we'll talk about humans and dogs and also talk about few diseases where dogs may be involved, may not be involved, but they are in the domain of being zoonosis and causing pandemics. And then finally, we'll talk about the challenges and the opportunities that can be solved through application of One Health. So firstly, let's see what is our global disease situation and what are the challenges that we see now. The first one of the global health situation is that it is just not COVID that happens few years ago and has caught the imagination of everyone. But the world has seen increasing incidences of infectious diseases such as tuberculosis, Japanese encephalitis, cholera, dengue fever, avian influenza. So new diseases are emerging and they are playing havoc with the public health systems. There are some older diseases like SARS, even older, HIV, bacteria resistant, antimicrobial resistance, the Ebola virus, the Nipah virus. I already mentioned avian influenza. And of course, the latest is the COVID-19, also the monkeypox, which did a scare some years ago. So, did you know that 75% of all the emerging and re-emerging diseases have some kind of a animal connect? These infections, they are threatening to have global impacts, and that could be because of some other reasons as well. such as easy and faster travel. There is a lot of human movement. So that could be one of the reasons. We'll discuss about other reasons as well. So they have global impacts. And as we try to adjust or combat these diseases, we also realize that global health scenario is also constantly changing, and because of some other factors, which also we will discuss. And that is why people predict that these threats are not gone away. They are here to stay. Only their frequency might increase. So it may not be every 100 years. It'll be now maybe every 25 years that the world will see a pandemic. So what does this say? It says that we all need to be prepared. Now, straight away jumping to what is One Health. One Health endeavors to have healthy people in a healthy environment along with the healthy animals. It looks very, very simple, but it is not that. I mean, people who come from civilizations that are cent not centuries, I mean, millennial olds, like here in India or Egypt, Mesopotamia, they know that our forefathers have been maintaining this balance for a pretty long time. So the culture I come from, so there we can see a deity where the animals which are supposedly against each other live very in a great harmony within the same family, you know. So there was this sense of harmony between environment, the animals, and the people. Somehow this harmony has been broken because of various things. You may blame the industrial revolution, you can blame people moving from each other, from one place to another, people trying to rule, command, uh, mixing of cultures, and now fast travel, science, whatever. But these things have been changing. So, in the present scenario, how do we understand One Health and its implications? So, there is one definition which comes from my guru. I've got many gurus. So, he's one of the gurus who works on One Health. He is from Institute of Tropical Health in Basel, Switzerland. And he says One Health can be defined as the added value in the terms of lives of animals and humans saved, financial savings made, and the improved ecosystem services designed. And that design comes from a closer cooperation between the human health sector, animal health sector, as well as the people who are engaged in maintenance in studying ecology. Okay, as compared to the earlier approach where it was all in silos. So the human health was a responsibility of a human doctor, and the animal health goes to the animal doctor. There is another definition, and this is from ILRI, International Livestock Research Institute. There are many definitions. I like these two, so I've included here, and probably they explain in a much better way the way I understand it. So they say ILRI people define it as a integrative or collaborative effort of multiple disciplines that work locally, nationally, and also at the world level to attain optimal health. For whom? Optimal health for people, optimal health for animals, as well as the environment. And they constitute this One Health triad, where the health of each is connected with others. So if there is a disbalance in health of one, it is going to affect the other, and it is going to affect the health security of the whole world. So when I read about those people, I thought these are good definitions, but they still have to be broken down into in a explanation that is easy to give to a common man, right? So this is something how I would explain it to you. It has not graduated to be a official definition, but I think it will explain what I intend to mean by that. And that is that it is an interactive play between the humans, the animals, and the environment, okay, where all the stakeholders and the actors, okay, so who are the stakeholders? Stakeholders are general community, all the animals, all plants, you know, a river, and the sea, okay, and the actors. Who are the actors? Actors are the medical people, the veterinarians, the ecologists, the the politicians, the finance guy, everyone. So where all the stakeholders and actors use their skills or expertise and their resources for the mutual and a collective responsibility to do what? To prevent the disease, to detect, first to prevent from happening. If it happens, to detect it early, and then finally to control the diseases, also eliminate if possible, or to devise strategies to eliminate it, to achieve a optimal health condition. So that is one health approach. Okay. For example, in COVID-19, we certainly saw that there was a dearth of the PPE, which is personal protective equipment. Probably it was a good time where the protective equipment, which was held by the veterinarians or people who are not directly involved with the human medical situation, would had shared it early on with the medical people. Okay, so they are sharing the resources. Okay, or the labs could have been used for RT-PCRs. So that's just an example, but for most of the diseases there could be something where either the skill or the resources can be shared, okay, to achieve a optimal health situation. So why do we need a One Health approach? We need a One Health approach because of the zoonotic disease epidemiology. So what is epidemiology? Epidemiology is the way a disease behave in a population. So how the zoonotic diseases are behaving in the population. So they jump from animals to humans and also sometimes vice versa. So, okay, so that because of that, we need a approach where the multiple stakeholders come together to fight the disease. Then, because of animal health and food security. So, animal health is required because we depend upon them for food, for our well-being, for companionship, also for food security. So if there is a healthy animal, then we'll get healthy milk, or good number of eggs. Food security is a very important issue, which is generally ignored when talking about One Health. So that way, nutrition comes as part of One Health. So only if a good quality protein of animal source can come, which can be reared through in a very biosecure way, then we can have a good health security. Then antimicrobial resistance and drug residues, that is because the pressure on the land, the pressure on the societies, or the communities who are engaged with food production is increasing because of increasing population, because of economics growing, the demand for good food, high protein food increasing, and that's how these methods are being used. But on the contrary, they are also giving rise to antimicrobial resistance and bringing in bacteria that cannot be killed using the traditional antimicrobial agents. Cultural practices and risk awareness of human animal interactions. So there are many cultural practices which expose human beings to risk factors. For example, in India, in South India, there is a disease called Kaisanur forest disease, where people go to jungles to collect sandalwood, and there is a tick which bites, and there is a disease called Kaisener forest disease. So maybe in some professions, they, or some cultural practices, they put the human beings at risk So it is important to understand. So suddenly you cannot go and tell them don't do this, because this is their profession. They have been doing it for donkey's years. So you got to, or one health professional has to understand the cultural underpinnings and then give a solution. Climate change, self-explanatory. Things are changing. So climate change is happening. So the way animals, the environment behaves is a very, I mean, you know what I mean. So how things are changing. So the, for example, I can talk about my own thing that uh, I don't know if you have realized, but because I know it, the whelping season of dogs is changing. So earlier they used to breed in, say, February. Now they are doing it in April. Okay, and that is because the climate is changing. The reproductive cycle of the animals is getting affected. That is just one example. So climate change is bringing a lot of effects which is affecting the health security of the world. Then animals and socio-economic determinants of the of health. So socio-economic determinants, poverty, gender equality, and all those things, they also have a bearing. Why the preceding talk was about this mental well-being. So even that is something which is a determinant for having a One Health approach. Finally, animals are required a good environment, a good scenery, everyone likes. They are important for our own mental peace and for our well-being. So to maintain that, we need to have a holistic view, so that by doing something, we are not harming the other vertex of the triad. Okay, so because of all these changes, there are emerging and re-emerging infectious diseases. Here, the list of many things, many diseases that can be caused. And again, they all are due to the classic public health triad, which is an interaction between host, environment, and the agent. And that can happen whenever there is a disbalance in any of the triads that we meant, which is human health, animal health, and environmental health. So what are the drivers of this emerging and re-emerging diseases? I have listed the drivers one by one here separately, but in reality, actually, they are all connected. Let's examine them how. Like, so keep in mind that these events singly or in combination with other leads to a change in interface. Okay, and increased, for example, there is increased population, so there will be urbanization. That will lead to deforestation. That will lead to global warming. Okay, and there is this environmental change because of easy travel. The movement of humans and animals have increased. Okay, because of lot of trades. The products produced in one region is are being sent to another. Okay, so the movement and the factors that can cause diseases, they are happening all the more faster and in larger volume. So what is that doing? That is increasing the chances of spillovers. Okay, there is a pressure for the essentials of life. What are essentials of life? Which are water. I mean, we're gonna go into war over water. There is the other essential of life is crops. So with deforestation and urbanization, we have fewer land for crops. So what are we doing? We are using chemicals to increase the production. We are doing GM food, genetically modified food, but that is going to harm somewhere. Okay, so there is a pressure to increase production, and we are also using pesticides. For example, in animals, we are using antibiotic growth promoters. So all these factors can give rise to emerging and re-emerging diseases. What is a re-emerging disease? Re-emerging disease is a disease which was existing before, but is not now known to cause epidemics, but suddenly it appears, okay, and it is appearing in big proportions. It's almost like a epidemic or even a pandemic. That is a re-emerging disease, and rabies is one of them. So if you are still on your Kahoot, this is your next question, and let's see how you think. Which global health challenge do you think will best illustrate the need for a One Health approach? And your options. So this is just a poll. None of the question is testing your knowledge. We are just trying to see what you think about it. So feel free to answer, okay? Which global health challenge do you think best illustrates the need for a One Health approach? I have listed some. If people think there are other pressing problems, they can put it in the chat. I would request Professor Satpathy to compile them if he can later, and we can think what are the other issues pressing the world. Okay. Okay. I think the time is too short, so you got to be really on it. Okay. I think I just gave 20 seconds because I don't want to drag this presentation long. But anyways, 39% people think that climate change and vector-borne diseases are one of the greatest global health challenges. And I am wasting my time on rabies, which people, only 7% think that it is an important disease. Let us see if you can change your mind by the end of the presentation. Let's go back to the presentation. Are we good? Are we good? Can you see the screen?
Yes, sir.
Yeah, okay. So, so, so we have known what are emerging infectious diseases. We've got little bit knowledge about One Health, and we came to understanding that all we do with One Health, because of all this scenario of, of, of climate change and global warming and urbanization and infectious diseases and zoonosis and animals, what are we trying to do? We are trying to prevent, detect, and control diseases for optimal health security. So, can we predict, prevent, detect, and control emerging infectious diseases, the diseases that are happening now? Can we predict that the next disease would be that, and what strategies we should follow? What do you think? Can we do that? Has someone answered? You can just help me, Professor Satpathy.
Actually, the chat is disabled just
Oh,
to
okay.
reduce the distraction. Yeah, we have
Okay.
kept the question and answer open. They're asking a lot of questions, but
Okay, no worries. No
yeah,
worries. No worries. Okay, I don't know what you thought, but I think that it is
some are
not
saying
possible.
yes, some are
Okay,
saying
so
yes.
I'm sorry, you are wrong. So it is not possible to predict emerging infectious diseases. Yeah, don't think we are chatting here. We are doing this presentation as waste of time because we can still prevent and detect and control, but we can always know the factors, the determinants that can cause a emerging infectious disease, but we cannot pinpoint that this is the emergency, what, sorry, the emerging disease that is going to happen next. Okay, you know what I mean? So we cannot predict, but we can always understand by the determinants that are around, so that we we can always get a sign, early sign, that something might happen. We are going on the wrong way. But to pinpoint a emerging infectious disease is not possible. But the good news is that we can prevent it from happening because we know the determinants. So we have to have the knowledge of the potential interfaces. For example, what is, because of deforestation, the interface between the wildlife and domestic animals, or wildlife or humans, would increase. Okay. So if we are able to check that, then we can prevent it. Okay. Prevent microbial evolution. So if we know that there is rampant use of antimicrobials without a thought, and the antimicrobials are available over the counter, then probably we have to put a check over it, okay, to avoid or to stop new evolution of microbes and mitigate the other drivers of emerging infectious diseases. For example, in many parts of India, um, you can see uh, so many determinants pooled together in one place. So at the same shop, they'll be selling meat, and meat of different kind. They'll be selling goat, also in some areas where I am in Northeast India, also pork, and also live eggs. And they would also be selling vegetables, and they would be also selling milk. So this is a sitting time bomb where there can be a cross multiplication of viruses, bacteria jumping from one species to another. So we are providing them a very conducive atmosphere. So if we are able to regulate how these things are put into the market, if you remember, COVID also is thought to have started from wet markets, where the wildlife, the domestic uh, mm, mm, animal meat and other things were being sold in together. So that gave it a chance where all these bacteria or the virus can intermingle and cause something new. And how can we detect? We should have a robust surveillance system. And for that, we should know what is the epidemiology of the disease. Where are the vulnerable points? Where are the hazardous points? And where the checks have to be put? Okay. We should have environmental scanning. So, for example, rabies is transmitted. I'll talk about rabies very soon, but rabies is transmitted actually from the wildlife to the domestic dog. So the wildlife also is dying due to rabies. Except for bats, it affects all warm-blooded animals. So if we can have a scanning of all the carnivores that are dying in the fringe areas, probably we'll get an idea of the burden of rabies in the fringe areas. What is the frequency that it is jumping on to the domestic animals, especially the domestic dogs? Okay. Thirdly, we should have a robust diagnostic capability, and that is not only for human health, but also for animal health. So, generally, the animal health is poorly funded, it always lags behind. There is a thought process which thinks that the labs could be used mutually, which I'm personally very against. Again, you give it a very conducive atmosphere where this virus can jump into others. But we have to increase the infrastructure, improve the infrastructure of not only human disease diagnostics, but also the animal disease as well as the zoonotic disease diagnostics. There has to be a capacity building. And finally, once you detect the disease, can you control it? Yes, of course. If we have proper laid down protocols for outbreak investigations, firstly, we should be able to prevent them. But if at all it happens, we should have everything in place so that if it happens, we put that mechanism into place and the things are arrested right at the beginning. We nip the evil in the bud. There has to be an increased consciousness about biosecurity and biosafety procedures. And finally, for everything, for our understanding, for application, for planning, for advocacy, for policy, we need to have a one health approach. We cannot have a single-sided approach that this is an animal disease, so there are no other things that contribute to it, which in other words is called systems thinking, where you have to think in a holistic way about all the factors which are majorly or minutely affecting the disease or causing disbalance in the triad. Oh, sorry. Okay, so this is your next question, and you can start answering. Yeah, can you see it? The question is, if you had to fund only one health priority in your country, what would be, what would it be? Okay. So it is a opinion. You can say anything. I can help you with maybe antimicrobial resistance, maybe rabies, uh, yeah, maybe Japanese encephalitis. Yeah. So if there is one health security, or maybe taking a broader view of doing something for the climate change, or for the food security, or for capacity building of the domains which have not yet been there. Yeah. There's only one person who's answered it, and they say for people. Yeah.
Participants, please show up some response. Okay, our eminent speaker is asking you to respond to the poll. You should
No,
respond.
no.
Please show up some energy. Huh? Lost energy at 8:33 p.m.
That's all right. I'm not eminent. That is why I'm requesting you. Okay, no worries, no worries. So, yeah. So, let's go to our next slide. And now we'll see why now that the topic includes Asia and the Pacific. So, let's see why it is important to have Asia and the Pacific for yeah. Can you see the screen? Yeah, okay. So why it is important in Asia and the Pacific region for the One Health concept, why it is very important. You know, during COVID-19, there was a lot of economic turmoil all over the world, but the most number of people who were pushed back to poverty belonged to this region. You know why? Because the economies were growing so fast that it could not take the onslaught of so many lockdowns, and people were pushed back into poverty. And most came from the South Asia and Asia Pacific region. Okay. Because this region has the fastest growing human population in the world. Okay. At the same time, these regions are also propelling the world economy. These are the fastest growing economies. And what does this mean? This means that people are getting richer faster, you know, the magnitude by which people are getting faster, getting access to money is faster here. And that means that they want or they need or they are desirous of better food, better houses, big houses, and that is putting pressure on the land. So, because to solve the food's insecurity, what is happening? They are using antimicrobials to increase the animal protein production. They are using pesticides to increase the crop production. And that is why there is increased diseases which are coming indirectly from use of pesticides or by genetically modified crops, and also by increased antimicrobial uses. So that is giving rise to new bacteria, evolution of bacteria, which is resistant to the common antibiotics. There is rapid deforestation, and that is increasing the conflict between the wildlife and the human beings, all the wildlife and domestic animals. And that is again giving an interface where the diseases can be spill over. Okay. Dogs and One Health. Now we come to dogs. And I want to know, what do you think about dogs and One Health? How are dogs connected with One Health? So your options are: if you don't play this time, then I will not play the next polls. Okay. Okay. What comes to your mind? Fastest fingers.
Please be quick, 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 quick. It's only 30 seconds. Go quickly to Kahoot and use it. I think we have to tell them beforehand so that they go
Yeah.
quickly. Nobody has filled it yet? Have you
No,
all
I've got
left?
27 answers. Yeah.
Okay, that's correct. Okay. I
Yeah.
can see it.
30.
Okay, now it's working.
Okay. Great. So we got a tie between stray dogs as symptom of urban waste and governance failures, 24%. And we have also got people thinking that dog bites, rabies control, and dog vaccination is what that comes to what their mind when we think about One Health and dogs. Okay, thank you so much. And we go back to our presentation. And now I am talking more about dogs and the rabies and what do you mean by that? Okay. Mhm. So, dogs and human beings have a relationship which goes back tens and thousands of years. Okay. The the popular school of thought is that they were one of the first animals to be domesticated by man, and people think that man domesticated them. But actually, there is a school of thought which thinks that the lazy wolves, they came nearer to human beings because they were lazy and they were finding very many edible litters nearby, and that's why they came in proximity of human beings. And slowly breeding them, they lost all their ferociousness, became timid, and with years and thousands of years of mm, of crossing and crossing, they became dogs. Okay. But as this was happening, the concept of domesticating these dogs, they were first companions for hunting as and also to warn them against wild animals. But the concept of domestication after tens of thousands of years, it differs between the developing countries and the developed countries. While in the developed countries, these dogs have found places inside the house of the people, even their bedrooms. But in developing countries, somehow we have left them on the streets. So the concept of domestication got stopped in between. Most of the breeds all of the breeds that exist as pedigree breeds, they are all crossed and back crossed to segregate one kind of a character, and that is why they show either cosmetic or behavioral factors which are desirous by people who want to buy them. On the other hand, the so-called stray dogs or the free roaming dogs, they are n- they have not undergone any selection for their breeding. So they have become stray because of, again, urbanization and people living in small houses. So they cannot keep the dogs as their own family member. So they throw them out. And when they are out, with indiscriminate breeding, their numbers increase. I can talk about India, which is known to have more than 60 million dogs, okay? And with the lowest dog ownership ratio, which is out of 1,000 dogs, only 4 are domesticated. And those 4 certainly are the dogs which belong to the pedigree category, like Labradors, German Shepherd, Pugs. So none of them are stray dogs or the free roaming dogs. And this dog mediated rabies caused by dogs, is generally 96% it comes from the free roaming dogs, because their movement is unrestricted. First, they are the first ones that get bitten by the wildlife. They come to that interface, and the spillover comes to them, and through them the disease is maintained in the free roaming dogs. So what are the factors that influence the human dog relationship today, and which is just a interplay between the restriction of the dog and the carrying capacity, the dependency. So carrying capacity is defined as all the factors in the environment that allows a species to survive. So for dogs, it is food and shelter. So when their dependency is full, okay, when both shelter and as well as the food is provided by the owner, or when it is totally restricted, then they are restricted or supervised dogs. In villages or a little bit rural communities, there is a concept of neighborhood or community dogs, where the dependency is full, however the restriction is only half. So animal is allowed to roam around, however it comes back to only one place for its food and shelter. And finally, the son of the soil, a dog that is born on the road. It fights for its food, fights for its subsistence, and it dies there. So they are truly urban ferals. So in India, they are there in every city, and they are the ones that suffer from rabies the most. And they suffer, and unknowingly, inadvertently, they also cause the deaths in human beings. So why are we failing to control rabies in India? Firstly, because of inadequate awareness, and that is accentuated by presence of so many beliefs, so many ritualistic things. People are not serious about when they get bitten by a dog. It is a disease of the people who belong to the lower socio-economic strata, and many a times they don't have the wherewithal to go to a hospital to get a pre-exposure prophylaxis. Many times they don't know. Many times they rear a dog, but they don't rear it, or they don't domesticate it in the true sense. So it is allowed to roam about. It goes out, contracts the disease, comes back, and because of love and care, it unknowingly the person gets the disease, and they die. So awareness is a big factor which causes so many rabies deaths in India, and failure to control it. Secondly, there is no incentive. Okay. So other diseases like child and maternal care, so much funding goes into it. HIV, so much funding goes into it. But this is a neglected disease, neglected by the government. They think other diseases are more important. There is something you all must be knowing. There is something called DALIs. So there has been only one DALI study on rabies, and it found that it was more than JE, Japanese encephalitis, or schistosomiasis. But there are not many studies like that can get the government attention to it. And that is why the policy decisions are also affected. Again, when you go to the research part, there is hardly any studies that study dog ecology or dog behavior, their interaction with human beings. Is it wise to leave them on the streets? The whole society is working at extremes. There is no middle path. Either they are dog lovers who think on one extremes, or there are people who think that these dogs should not be on the streets. but they are thinking their the things they want to execute is on the other extreme. So there is no middle path. There is no accommodation between the two ends. And that is one of the causes of failure to control rabies. Studies on impact of interventions. So all the interventions of rabies are known. It is a disease of 5,000 years. They say one of the oldest scriptures written in the world called Vedas. So they mention rabies. And they say it comes from a very old Indian language called Sanskrit, which says Rabha, which means violence, but still, in India, India clocks the highest number of human mortality due to rabies. And that is because we are not strategically properly poised to fight this disease. So even if we do interventions, we don't see how effective they are. What can be done to do a course correction? Then we don't even know how many dogs are there. What I said, 60 million, is just a estimate. But we don't even, like, if I ask someone how many dogs are there in their own street, probably they will not be able to tell them. And the herd immunity in dogs needs to is 70%. Like 70% of the dogs have to be vaccinated to have the herd immunity, or for the cycle of the virus to break among the dog community. That we don't know how many they are there. So how can we vaccinate 70%, given the other factors of such difficulty in catching a dog and vaccinating them? And finally, there are many players, many stakeholders and actors in this area, but none of them are sharing their expertise or their resources or coming to a mutual planning so that the strategies can be developed with each other's coordination. So there is lack of coordination.
Okay, Dr.
So how
Tiwari,
can we?
how long do you think you will take? Because we have a panel discussion to follow after this with
Yeah,
you.
yeah, yeah. I'll go very fast. Don't worry.
Yeah,
There are
yeah,
not
please,
many
please.
slides left. Yes.
Okay, thank you.
So, yeah. So how can rabies be controlled? Can be controlled in human beings and in canines, both. So if you control it in canines, it naturally controls the human deaths. So there could be mass dog vaccinations, there could be dog population management measures, and of course, awareness in the people about responsible ownership of dogs. Okay. Similarly, in human beings, there needs to be a proper awareness about dog bite wound management, awareness about the availability of PEP, post exposure prophylaxis, if one gets bitten, and finally, awareness about the disease. So this is a way I gonna very fast make you understand all this is kind of a dag. It is not a dag, but you will understand how the fight against rabies is happening in India. We know everything about rabies. We know how it is caused. We know it is fatal if not attended to. We know we need PEP, but somehow and we are taking the measures. We have PEP available in most of the PHCs. We are also doing ABC, animal birth control things. We are also doing mass dog vaccination, but this is how we are doing it. We know it is from rabies virus transmitted by dogs, and yes, about 35% of the mortality is in children because of various reasons. They are vulnerable and they're not likely to report. They are free roaming dogs all over because of our societal acceptance, because of various other reasons. There is garbage everywhere that provides carrying capacity. We have a very, very poor parking system in our country, because of which the dogs find a shelter under the cars. Number of cars is increasing, but the the parking problem is not being solved. There are many people who feed them, good on them, but we are also very, very, very we provide the Indian streets are full of edible litter, so the dogs find their subsistence very easy. So what are we doing? We know about washing. We are doing something about that awareness also. We have provided PEP everywhere. We are controlling the dog population. We can cull them or we can do birth control. We know that culling is not humane. So we are doing birth control, but we don't know much about proper population dynamics. We are making some estimates and then going for mass vaccination as well. We are improving the diagnostic things as well. Somehow, somewhere, some people are also doing responsible ownership of dogs. We are somehow trying that probably these dogs can be given some economic values. They also have some use. Why only adopt dogs? Why can't they be put a value and they can be bought? If a person buys something, then he takes care of it. He takes it for vaccination. So this is how, we are fighting the disease in our country. We are doing everything. Does it make a pretty figure? So we do mass vaccination in one place, awareness at another place. It is all haphazard. So why are we failing? Because we are not applying all the methods at one time at one place. What needs to be done is to be done in a strategically logical way. Okay, so all that we are doing, it has to be done in a progressive, in a systematic way, whether it is awareness, making the vaccines or immunoglobulins or dog vaccines available, studies and application of dog population dynamics and the diagnostic. So I will quickly skip this. Coming back to One Health in the parlance of rabies. So what are the core principles that can be applied from the One Health perspective? One is systems thinking. I already told you. So nothing happens in isolation. It has to be done when thinking about systems. So there are other departments, other professions also affected, however majorly or minutely. There has to be intersectoral collaboration, global and local integration, transdisciplinary and multidisciplinary engagement. So if we talk about rabies, it has to be a combination of human health people, animal health people, the municipality, the waste management, this education department, the finance department, the politicians, everyone. And then we have to do evidence-based decision making. So whatever strategy we apply, it should be supported by a success or a failure or a evidence for it, so that we are able to examine whether the strategies, whether the interventions that we are using are effective or not. Then we have to work on a strategy which is more about prevention than on response. One vaccine costs huge money. Although in India it is supplied free of cost, but it is costing the exchequer something. So why can't we develop a mechanism, a surveillance thing by which we can save on the PEP, but not at the cost of the life? But yes, but we have to develop something that so that the preventive measures become stronger. Then good governance and policy coherence. Of course, when these things reaches the policy makers, they have to apply policy and rules and regulations, make their implementation stricter. For example, dog ownership. It should be completely owned or it should go to a shelter home. Okay. Whatever measures we apply, they should have a sustainability. It should not be a one-time measure. It should not be something that needs to be taken care of through charity. There has to be a business model that can run the system by itself. And finally, the One Health approach, and I'm talking in parlance of rabies, it could be, it should have resilience so that if there is a change in the system, it can still withhold. If there is, uh, if there is direction of funds to something else, it can still survive. The system can still survive. And that can only happen when we can institute or when we can start behavioral change in the people, in their attitude towards the disease, and more importantly, their attitude towards the animals. So One Health is all about C's. It's about coordinating between different departments, different disciplines, collaborating with them, and come to a strategy that could be communicated to the affected community in a proper way, in an effective way. Okay, so that is all about One Health. It is just not animals, environment, and the human health in the way it is seen, but it is more so with more partners coming in, even community, educationist, municipality, the wildlife people, the environmentalist, ecologist, everyone has to be part of that One Health game. So yeah, I'm almost reaching the end of my presentation. So there has to be a interdisciplinarity between social sciences, who can bring in studies and then execute plans for bringing in behavioral change, humanities, also science. What else? I said maybe maybe people who are legitimizers, people you who can change people's behavior, like maybe sportsmen, famous people. They can come and advocate about One Health, and people will be more receptive to their ideas. Okay, things should be, we have to take out the scare of out of it. We have to take out the people, the aloofness out of not only rabies but any other disease. We have to find out interconnectedness, and for that we need very important thing in the modern era, and that is data sharing. So there has to be data sharing between the different disciplines, so that they understand if whether the disbalance is happening or not, and when it is happening. Okay, then transdisciplinarity, that is in the society, between the community, between the people who are doing this research, between the politicians and the policy makers, and finally the professionals. Okay, so all have to have a common platform, maybe at at bring it to the granular level, maybe at district level. Okay, where they should meet maybe every 3 months. At block level they can meet every week for 1 hour for a cup of tea and exchange ideas. The tragedy with pushing One Health in modern world is that it is always a top down approach. It is coming from WHO, OIE, central government, asking people to do this. Personally, I feel that it should start at the grassroots level, the awareness, the meaning. And it has always been like that. For example, in India, there is a community called Bishnois, and please Google about them. So Bishnois, their relationship with environment is so strong, and they have never suffered these infectious diseases. They have never suffered zoonosis. They even eat together with the animals, but nothing happens to them. So there is something that is causing this disbalance, but we can always gain from traditional knowledge of our own uh, societies, how they have survived so long, and suddenly why there is a disbalance and why we are at the door of this frightening situation. You guys are not good players, so I'm skipping all this. Finally, okay. So I have served 17 years in Indian Army, so I can't help trotting my gun out. So if rabies is to be killed, rabies, dogs are not responsible. They are only mere transmitters. They suffer as much as we do, probably more. So the culprit is the virus, and we have to get rid of the virus. And we can get rid of it only when there is a multidisciplinary approach, where the medical people, the veterinary people, the ecologist, the politician, the education people, even the cultural leaders, even and the people who give funds. So in my experience, funding is one of the most important aspect that lacks in anything, and more so in One Health area. There has to be a coordination, but there also has to be a very strong feeling of conflict resolution. because here you get multidisciplined people coming on a platform. So who leads and who does what and who follows, So there has to be a proper strategy laid down for a very strong One Health team. So with this, I think I have been able to instill some feeling of a collective responsibility towards global health security. This is something I clicked when I was in army. Please forgive me for the spelling mistake. Mountain is not higher than your confidence than, not then, because it will be under your feet once you are on the top. So the path is difficult. Rabies, we have been fighting it for 5,000 years. We have One Health approach now, but the task is still very big, mountainous. But we have to keep going. We have to apply all One Health measures one time at one place and then replicate it, emulate it elsewhere. We should not forget our own social, cultural beings when we fight a disease, because these are important determinants. But probably when we do all this and with the new generation thinking health in a more holistic way, we will be able to achieve a better health security for the world, which also includes rabies. I'm repeating rabies because I'm passionate about it, but it concerns all diseases, including antimicrobial resistance, and more importantly, with growing population, the problem of food security, malnutrition, and everything that comes with it. Thank you so much for your time. I'm open to questions. I love to take your questions. I'll try to answer them, but if I can't, you may please forgive me. And you can ask my friend ChatGPT after that.
Okay, okay. Dr. Tiwari, thank you so much for such a brilliant and such a heartwarming and such profound wisdom and so much of experience that you have in the sector. And it's very much palpable just by looking at the number that is rising, as the session is increasing. So, but we have a small panel discussion to follow after your lecture, which is a structured process. Okay, we are running actually very late behind right now, but so therefore I'll do a quick round of fire of questions. So please do not mind, and you have to be very quick to answer them. So, okay, so I'll go ahead with asking you the first question, which you have sort of answered, but I would still give you a little bit more time to tell us about your experience. So tell us about your journey with CRE India and how it has been playing a role in advancing the agenda of rabies-free India, especially in northeastern part of India.
Okay. Yeah, thank you for this question. So, CRE India is basically CRE India. CRE means collaborating for rabies elimination in India. Coming to Northeast India, so this part, we had very few data about rabies here. And this is a very interesting area because this is the only part of the country which is surrounded by 5 countries, 5 international borders. Okay. So there is a lot of scope for transboundary diseases, and rabies happens to be one of them, where dogs cross to the other countries and carry the disease. Secondly, this is the only part of the country where the cultural mosaic is very, very diverse as well as integrated. So you have communities that eat dogs, and you have communities that worship dogs living side by side. So this is very exciting. So we have to learn from them, and they have been surviving for centuries. There are so many other reasons, but yes, these are the salient points that I came here to do the research. And my experience is that we have to include the strengths, as I said, the traditional knowledge existing, as well as the cultural traits that we have. So I'll just cite one example. So we did a key informant interviews with traditional healers who are generally demonized in India, that they take the patients astray. But I realized that there is something more than physical health, and that is mental health. And even though their medicines and their traditional practices may not be very very much in line with the modern medicine and may not be helping the patients too much, but they somehow give mental succor. But the plus came when I found that none of them were opposed, that after the dog bite victim comes to them, they will be happy to direct him to the nearest PHC to get post-exposure vaccination. So I think when we talk about One Health, it is just not the medical doctor, but anyone who has a stake in providing health health to the patients. Their processes may be wrong, so but it is only relative, but they can be synergized by the other stakeholders and actors coming into being. So this is just one example. Okay, so there are many things that needs to be done, and Northeast is very exciting because I feel that it is very different from rest of the country. But at the same time, what we develop here can be easily emulated elsewhere. You know, it can be just put elsewhere as a model, and it can be picked up. I hope I tried to be very fast. I hope it ticked few
Yeah.
of the boxes at least. Thank you.
Yes, yes. I have about 10 questions for you. So this is just the first question. The second
Mhm.
question is, what are the key policy and research imperatives of the One Health framework in Asia and Pacific? You have covered a bit, but I want you to specifically answer about the key policy and research imperatives.
Okay. In Asia and the Pacific, I would say the Pacific is a little bit better off. There are a number of networks that are working there. To name some, I have interacted with Sihun. So that is a One Health network which has all the ASEAN countries. There is another network which is called ASEAN One Health network. There is one which is supported by the UNDP as well. Most of the um, uh, policy framework in this area revolves around antimicrobial resistance and also for food security, because the land pressure in Southeast Asia is huge. Mostly the population is meat eating, and all kind of meat is eaten in most of the Southeast Asian countries. So the policy frameworks runs on that way. I would also say that that has worked very well for the region, because countries such as Vietnam and Thailand, they did very well during COVID-19 because they had this One Health platforms working and running. Another, from my experience, what their framework has been able to do is to build the capacity of the collaborators or the stakeholders which are not at par. So as I mentioned, like the human medical sciences are quite high, and are low. So they are working very hard to bring the parity between the infrastructure of these things. So that forms another policy framework. Another important in their policy at a regional level is having a regional body, whether through CHOWN or a Asian One Health network, that actually calls the shots and they decide what has to be the next research thing or implementation things. Seehound also has implemented the policy framework of uniting all the One Health laboratories, which is a great achievement in Southeast Asia. One Health laboratories that are involved in One Health research and even for diagnostic purposes, sharing their data and again making the policies. So yeah, these are some of the policy things. Of course, the other things which align with the SDGs, like the gender equality, poverty removal, all through One Health, to have that holistic view, they also form the part of their policy framework.
Definitely, definitely.
Unfortunately, in Asia, although we face similar problems, we don't have such strong networks. Few things have started in India, There are things happening in Bangladesh as well. They have got a good One Health network. I think that came up in 2024. Nepal also has one. Pakistan has one. Uh, but at the regional level, we need to do a little more, maybe at the SARC level or something like that, because there are a lot of diseases which are facilitated by the transboundary movement of animals or animal products. So getting together will help to develop a policy framework that can take care of not only the zoonotic and infectious diseases, but also mutual help and care regarding food security. Yeah, I'm really scared about the our tables going without food, in the near future, and that's why I'm repeating that food security is something that we have to think more and more about.
Definitely,
Thank
I
you.
completely. Yes, I think all of these things are very much interrelated, and it all depends on the imagination of an individual. And we need to intersect and interconnect all these variables and these factors.
Yeah.
Many times
Yes.
people are unable to join the dots, and that is one of the reasons why they act in silos. Okay, so I move forward to the next question. How do you think we can and should effectively respond to the rising challenge of AMR in the context of Asia and the Pacific?
Okay. Yeah. Yeah. Very, very nice question. I've been involved in uh, a bit of a work of developing a network for the laboratories in three of the ASEAN countries, Cambodia, Laos, and Vietnam, for connecting their laboratories. And I have a few takeaway points from them, which I would elaborate here. But before that, I would say the cardinal things that are required for tackling AMR. First is the multi-sectoral collaboration, the antibiotics, the antimicrobial usage in the animal sector, in the human sector, and even in the agriculture sector. So there has to be data sharing uh, regarding the new resistant bacteria that are emerging, so that we can have early warning signs. So multi-sectoral collaboration is very important for AMR, for tackling AMR. Second is capacity building, whether it is diagnostics, collecting the samples. So capacity building of the networks, using of modern laboratory techniques, not only in bacterial bacterial resistance, but now the question is also coming up for the fungal resistance. Okay, so there is a lot of resistance happening in fungal area as well. So that also needs to be built up. The capacity has to be built up. Policy advocacy, and that comes all the way from the top, where the active principles are imported. So at the airport, at the policy level, at the government level. So unless until the active principles of the antibiotics are imported, they cannot be manufactured here, and they cannot go over the counter. So checking of the over the counter medicines or antibiotics is very important. And finally, spreading awareness, not only from a distance way like IEC and using of media, but by active community engagement. That is very important. The message what this antibiotic rampant use is doing to human health, or to animal health, or to environment health. It is felt that it is only the popping up of the medicine that is causing AMR. But there are many other things. For example, the free roaming dogs in Northeast, when the swab was taken, um, anterior as well as posterior, we found bacteria that is resistance. So the actors for spreading this AMR can be numerous, and it can only be arrested when the grassroots communities are engaged enough, engaged effectively, so that they learn what this AMR is doing to the society.
Yes.
And then I come to the final point, uh, which is provision of funds. So in Southeast Asia, the biggest thing was there is not adequate fund to carry out research and also to implement. So somehow at the um, federal level or maybe regional level, I don't know what is going to happen with WHO now, and what their priorities would be. But yes, there should be committed fund. There is a pandemic fund which is already working in this area. But yes, it has to be more looked into how this funding problem can be solved in the direction of AMR. So these are something, some of the One Health points that I can provide. Yeah.
Oh, okay, great. Excellent, excellent points, in fact. Okay, associated with what you just said, I have another question which will provide you a little bit more opportunity to tell us more about the core theme of this particular advanced certificate program. What is your overall experience in dealing with the complexities, like complex actors like government, academia, civil society, and the community members? And how does the complex process of strategic collaboration and communication work with these agencies and entities?
Okay, very interesting question. Not something that can be tackled in 2 or 3 minutes, because One Health actually encompasses many diseases ranging from AMR to food security and everything in between. So many diseases. So while there is a holistic approach which calls for coordination, collaboration, interdisciplinary, multidisciplinary approach, at the at the same time, within that there has to be a granular approach by which each disease has to be tackled in a way that is required. For example, Japanese encephalitis. So it is a play between the mosquitoes, the swine, the pig, and the human beings, right? So the strategy that should encompass, obviously, data sharing between the veterinary department, the medical department, and also somewhere the public health department. So why that mosquito is happening? Surveillance. So maybe use of modern technologies. My experience until now has not been very rich. I have been to many forums in India, and I'm sorry if I'm being very candid about it. There are very few examples in the domains that I have worked in my country, in our in India, where I can cite as a classic One Health solving examples. So still, as I said, most of these efforts are at the seminar level, at 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 talks level. There is a national One Health plan, but how it percolates down to grassroots level is yet to be seen. On the contrary, on the brighter side, I'm working in a aspirational district in Northeast India. Uh, Aspirational is a euphemism for saying a backward district. So there I found the district administration, the local civil society, very enthusiastic, and there is always a kind of a vulnerable community everywhere that is suffering more. For example, the area I'm working, there are tea gardens. So the tea garden workers, so these people at the grassroots level, I have found out that I have found to my pleasure that they are more eager to implement what you suggest to them and understand One Health about them. Unfortunately, uh, because it is a top-down approach, I have not seen that is on the top coming down in an effective way. It is coming down, but not in an effective way. For example, for rabies, there is a national action plan for rabies eradication, and for which every 28th of September there is a mass vaccination of dog campaigns. But hardly 10%, 20% of the dogs, and that too the dogs that are owned, only they get vaccinated. So there is no mechanism by which the municipality can be involved. The capacity building of dog catchers, their protection, increasing their remuneration. So all these side collateral things have to be taken care of. So I'm sorry to disappoint you, but yes, that is the situation, and that is my experience until now. I sincerely hope it will improve very fast.
Definitely. I think I completely agree with that, in fact, and there is no shame in admitting the truth, the reality of the scenario. You know. we need to be more humble and pragmatic about what's happening so that we can probably make some changes around it. Okay, so I go to the next question. How can we equip our young and emerging researchers in LMICs to lead the future of the One Health movement?
Yeah, can you repeat? I lost you in between.
Okay, how can we equip our young and emerging researchers in lower middle income countries to lead the future of One Health movement?
Yeah, very good question, very pertinent question, and I think there are many young people here, all of them leader in their own right. So yes, what I will answer you, it might sound like very philosophical, but that is essence of One Health. So One Health is all about accepting the other's point of view. Okay, and if you have that acceptance, that accommodation, and only then you can understand how the resources that are held by the other party can help you better, can synergize your efforts for a better health security. So, for the youngsters, I would say that they should keep their minds open. There are so many avenues available now to learn about anything, So, just learn about it. There are 2 points that, besides what I have already been telling, that to be accommodative and coordinate collaboration, avoid conflicts, understand others' point of view. Unless until as a veterinarian, I am ready to understand what the wildlife guy is saying when I am pushing my own agenda, how will I come to a One Health platform? I have to understand what his point of view is. Similarly, a medical person has to understand what a municipality person is facing on ground to come to a common ground where One Health can be implemented in a more effective way. So there are 2 points, rather 3 points, and I did not plan it. Believe me, they are again all C's. Okay. First is develop case studies. Okay. So whenever you encounter a situation, a disease, try to understand that, put it into words, try to put it in a public domain as a case study. So many a times we are still referring to the case studies that do not pertain to our own area. We study about a disease in happening somewhere in Europe by John Snow or someone, okay, which may not totally relate to what is the situation in my own country. So develop case studies so that more and more people can understand what the real situation here is. The second point is critical thinking, again a C. Okay, you have to develop critical thinking. If you have critical thinking, then only you will understand what is systems thinking. So what are the other collateral things that are affecting it? Okay, it has to be a holistic view. What are the other determinants beyond your own line that is creating that situation? So you have to be very critical about it, think deep about it. And the third C, believe me, I did not plan it. It is C, C, C everywhere. C is such an important thing in our lives. The third one is communication, you know. So, communication in a very effective way. You have to learn to communicate not only effectively, but be cautious that you are not bordering on misinformation. Okay, it can't be disinformation as professionals. At the same time, you should understand that if there is a disinformation, then how potently to counter it. So, for the benefit of people who who are confused between mis and disinformation, so misinformation is something that is spread without a intent to cause harm, and disinformation is a something that is spread to with a intent, with a malintention. Okay, so you have to be cautious. So just giving you COVID example. Okay, so people said uh, that if you we should not get vaccinated because someone one out of 100,000 got a reaction. So there could be that could be a misinformation. At the same time, people who were anti-vaxxers, so they were also spreading disinformation. So as professionals, we have to be very cautious how we are communicating the disease. Disease communication, unfortunately, even today, like, okay, this is an international audience, but most of my disease in my country belongs in villages, in rural areas, where they don't understand English. And I don't have a effective way of communicating in their not language, but their lingo, in the way they understand the best. So I think that is one area I would ask youngsters to explore more. If the health security has to be made robust, communication of disease in the most effective way in the language that the rural population or the people, the most vulnerable of the communities, understand the best. Okay, instead of printing IICs in English and yeah, whatever.
Yeah.
So you know what I mean. So it has to go to the grassroots
Yes.
level. So
Okay.
it has to be
Okay.
presented in that way. Thank you. I
Yes.
hope I was
So,
able to tell them
yes,
some
yes,
things. Yeah.
yes. Since we are like overrode with the time, I would just
Yeah.
request you to be a little bit more precise and more quick, maybe.
Mhm.
I know you're trying to do like full justice to giving the best quality answers,
Yeah.
but our young
Yeah.
listeners are also getting a little impatient, it seems, because they
Really?
have to fill.
Okay.
Yeah, no, because they have to fill the attendance form. That's why.
Okay.
So they're sending a lot of messages in the Q&A. Okay, so how do
Okay.
we make progress in terms of cross-functional and multi-systemic partnerships to inform and shape global partnerships to further the agenda of One Health?
Okay. Okay. Can you just repeat? You
Yes,
ask me
I
such tough questions and ask me to be quick. I mean, that is not fair. Okay.
okay. Let me try
Okay.
again. Okay, let
Yeah.
me try again. How do we make progress in terms of cross-functional and multi-systemic partnerships to inform and shape global partnerships to further the agenda of One Health?
Okay. Okay. The question seems tricky, but the principles remain the same.
Yes.
Okay. So yeah, I'll start with what we talked about in the first question. So we have to network. Okay. Very important. Across the sectors, we have to do network, and the network should be pivoted around One Health. And then you have to think very critically who all can be partners to it, not just the triad. They could be multiple vertices. They could be at places, maybe even army could be one of the contributors to the One Health team, so you have to network, and the network should be formed with critical thinking. Second important thing is we have to improve our surveillance, and surveillance not only in one sector. So we have to understand how multi-sectoral surveillance can be improved. That could include cross-border syndromic surveillance, early warning signs for outbreaks. How that surveillance system can be developed, and for that, it is very important that intersectoral data sharing is very robust, continuous, and the data that is collected is healthy. It just doesn't come from, yeah, mm, it shouldn't be very weak. We have to think about new ways of data collection beyond the quantitative traditional way of data collection. So they could be more approaches, qualitative approaches to understand these things, and that could be another way. Capacity building is important, multi-sectoral capacity building in their own profession, and capacity building how they work together, okay, in a coordinated way. So that capacity building, how one caters to the need of others. So that's very important. Then I think, as I mentioned in the first point, there has to be a emphasis to develop regional policy dialogues. So thinking about a country such as India, so it could be interstate policy dialogue. So what applies to one state to the another state, so the policies should be coherent, and for that we need to have a dialogue periodically maybe once 6 months, once annually or something, so that we revise where we go, where we're going, and how this mechanisms can be strengthened by every time. Yes, and finally, probably also somehow I'm very big on disease communication, so that's very important. There is less time, but otherwise, I could had I could had just I'll take this chance if you're getting bored, but you must know this, that a person died in the place that I am working, bitten by a dog, because he did not take vaccine, because there is a prevailing information that if you take anti-rabies vaccine, you cannot drink, you cannot consume alcohol for a month. So he did not do that, he did not get the vaccines, and he died in 2 months' time. So this kind of things can be sorted out only when we understand the prevailing myths, misinformation that is prevailing in the area, and then develop a very good disease communication system. So again, in multi-sectoral thing, we have to develop a disease communication mechanism, syntax, the way we project it in a way that applies to the people for whom it is directed. I've tried to be very fast, Professor Satpathy.
Yes, certainly, certainly. Okay, so I have the last two questions for you, Dr. Tiwari. The first one, according to you, what are the major challenges or threats to advancing a One Health system in the LMICs?
And there is only one challenge. It is a very no. One Health is actually not new. It's about 20 years old. Only thing, it's gained strength after COVID. So there is only one problem, and that is conflict. I see that there is bound to be conflict when it comes to various professions, especially those who are quite close, where the domains of knowledge sometimes overlap. There could be a lot of conflicts. There could be conflicts of hierarchy, and that would stymie the process of implementing One Health. So, and how we can solve it? Probably promoting more interdisciplinary projects, probably by funding more. I think the world bodies are moving towards that. So, by promoting more multi disciplinary and transdisciplinary projects, racking their brains how the determinants from supposedly other domains are also influencing the health on one another aspect. So those kind of critical thinking can solve this. Otherwise, One Health is something that everybody in principle agrees about, and it is the new baby in the town. Everybody wants. The problem is everybody wants to take it on their lap, but doesn't want to give it back to someone else. So I would, the only way out is probably the baby grows up very fast, so that there is no time to take it on the in the lap, and yeah, everybody is around it serving it. So that's more important. So conflict resolution, ways for conflict resolution in a One Health team, that is the biggest challenge, and it can be only solved with bigger uh, with a bigger knowledge base, and practical aspects of multidisciplinary research.
Definitely.
Thank you.
Each discipline takes its own course of evolution, and I think this discipline itself will
Yes.
also take its own course, and it's only for the future to decide what's about to come.
Yes.
All of us should stay
Yes.
very patient and maybe engage with it as we can,
Yes.
and then hopefully we'll make some sense out of it. The last question to you, Dr. Tiwari, what does the future look like for integrated One Health advocacy and global health diplomacy?
I think the future looks very bright, especially as the realization has dawned very fast and very effectively after COVID-19, that there is a need for multi-sectoral approach. I'm very optimistic. There are hiccups, again, for the points that I mentioned before. but I think the future is good. There will be a more multidisciplinary institute coming up. At the same time, we should not be oblivious of the fact that the One Health platform can only be strengthened when the individual stakeholders and actors are good in their expertise as well. So one has to be really very good at their own expertise. At the same time, be accommodative and understanding of others' point of view. You know, it is somehow I feel that in many quarters, it is felt that it is about learning about the others. No, it is about understanding the other's point of view, to accept that if I have expertise in my domain, the other person comes with a equally strengthened point of view. And on the One Health platform, we have to reach a level of wisdom whereby we are ready to accept what the other is saying, where I leave a seat and ask others to lead that or to contribute in a bigger way, you know, to be accommodative, to understand others' point of view. That is going to come. And as you see with the with artificial intelligence, just an example, penetrating each and every part of our lives. So this is such a One Health thing. So it is going everywhere. Okay.
Yes.
Coming to the very granular point, if I am eating a packet of chips and throwing the chips on the road, if I get that wisdom that doing that, I am harming One Health, because it is going to block the drainage somewhere, which is giving rise to mosquitoes and others and drain problems, which is a risk factor for so many diseases. If I get that wisdom, okay, which eventually will come. Again, other points like improving lives, uh, removal of poverty, equity matters like gender equality, empowerment of women, all that part is embedded, because every section of the society empowering vulnerable communities. So not only fund wise, but also education wise, facilities wise, all these things, they are already improving. But yes, eventually the future is going to be that one path, one combined path. And the day people realize that all paths lead to the same God, then yes, One Health will be really strengthened. I hope I'm able to convince people about it. So all the youngsters who are thinking to move in this path, welcome. It is always good to step outside of your own shoes and look at others and see how that is going. Ask them about it and try to think critically how that can align with your own fight towards disease freedom and health security. Thank you.
Okay, so such profound wisdom, and I don't think anybody could have done a better justice to this job than you, Dr. Tiwari. So I'm indebted to you for coming on board and illuminating all of us, especially me. I thoroughly enjoyed the talk. And I'm sure the young participants who are listening to us, they also enjoy it, because that can be attested purely by the level of enthusiasm and the compliments they're giving you in the question and answer section right now. Because the chart is digital, so they're giving a lot of very good compliments to you. And they're actually
Yeah,
telling
I
many
have to
good
go through it.
things. Yes, yes, please go through. We'll actually compile some questions for you later on, because we do
Yeah.
not have a lot of time now. So thank you so much for everything that you just said and said. And I do not think I'll do justice if I just say thank you. I think I'm completely indebted to you for coming on board and sharing all this profound wisdom and all the insights that you have gained over all your life in your workplace all over the world. And I think
Yeah.
our youngsters who are listening or have listened would be able to use this knowledge, will be able to use all these perspectives, which are very essential to think in terms of One Health. And what you just rightly said, that all religions say the same thing and they lead to one God. The same way, every health, one global health, community health, public health, all sorts of health we are talking about. At the end of the day, it is one health. It can't be several types of health. It has to be imagined in one form as a uniform form. Yes, but it has to be informed by the core principle of India, unity in diversity. So maybe different forms and different entities and different stakeholders have to inform that. And that is probably also the philosophy, core philosophy, which lies at the heart and center of. And many people simply don't understand. I still get to talk to people from medical backgrounds, and they have a lot of misconceptions regarding One Health. They think One Health means basically veterinary medicine, not really uh, anything like environment and medical issues, everything. Like literally, do not think beyond that. And I can empathize with them, but I think it's time also that we move beyond the sets of ignorance and maybe spend a bit of time to, um, you know, uh, reimagine how we think about health in the 21st century and One Health in the 21st century. So thank you so much. I would now request, yes, you want to say something, please.
Yeah. Are you closing?
Yes, yes,
Yeah.
yes.
Yeah. Okay. Yeah. So thank you, Professor Satpathy, for this wonderful opportunity. I would also like to thank my previous postdoc, Dr. Parimala Mohanty, for introducing me to this forum. I am thankful to you for such kind words. I'm very sure I'm not deserving all of them. And at the same time, I would also, I think all of you enjoyed my talk. And I would like to thank you for your time and patience to go on with this kind of a mundane topic. I'm sorry, my Kahoot was not a hit, but probably next time everything is a learning. So thank you so much. I thoroughly enjoyed speaking to you all. My only regret is I could not see all the faces, but yes, it was wonderful. Thank you so much. Good luck to all of you in your endeavors, in your careers. Do well. Life is beautiful. Enjoy it. Thank you so much.
I would like to say a few words to you, Dr. Tiwari, that in the tradition of advanced certificate program that we're running, this is a global advanced certificate program. More than 850 plus have registered, and more than 300 people are research active. That means they are working on their individual projects as well as group projects with us, and they will be submitting that in the last week of July and will be graduating from this advanced certificate program. This is a very intense and very hand-holding immersive life experience. They are actively engaged in research projects. On a daily basis, they are receiving tutorship support from top mentors from different parts of the world. And in the tradition of the advanced certificate program, every research person and eminent resource faculty who visit us, they get to pen down their signature on the certificate which they receive at the end. They receive two documents. First is the certificate of completion, and the other document which they receive is called Statement of Higher Education Achievement, which is in the pattern of UK and Australian education system. So on that certificate, you would be able to pen your signature, and they would be very lucky to have your signature, so that they will be able to attest, like, okay, Professor Tiwari has taught us.
It is
You
an
are
honor.
now their mentor. You are their mentor now.
Yes.
So I think they deserve it. So our admin team would be in touch with you regarding two things. First thing is your presentation slides, for which at least 20 people have requested so far. And then the second thing is your signature, e-signature, which will be penned on the certificate. And after that, I would like to also mention one more thing, that we are not rich or we are not supported by anyone. This program is offered completely for free to all our 800 plus participants. So we cannot offer any souvenir, but we would be honored to provide you a certificate of appreciation for all the time and all your wisdom that you offered and said without any hesitation and with all your generosity.
Well,
So
thank you.
we are profoundly indebted. And there are many questions coming up. Unfortunately, there is simply no time to ask you. I wish we could manage the time a little bit better. But they are saying like invaluable insights. They are saying it's wonderful, sir. You have explained things from sand to sea. Thank you. And they are asking actually very valuable questions. I do not know how to go about it. Maybe I'll compile them, sir, and I'll get back to you. That's the only way. Because these are very interesting questions, and I think you should just probably educate them more. Because our learners are very, very curious and very passionate people, and is testified by the past 1 month, because they are engaged on the research project daily, and we engages with them on a daily basis. So therefore, I can say that the questions they are asking are very interesting, and I would get back to you. And with this, I would hand over this mic to Hazel to do the news. Hazel.
Thank you, sir. Thank you, Dr. Harish Tiwari, sir, for your outstanding panel tonight. From mental health systems to One Health governance, today's session offered a dynamic exploration of the intersections shaping global healthcare today. To all our participants, thank you for your presence, your questions, and your engagements all over the sessions. So let's continue to learn, collaborate, and act with purpose as we shape the future of equitable public health together. Good night, and I look forward to seeing you at the next session.
Yes.
So thank you all, and
Okay,
thank you,
in the
Harish
next
Tiwari, sir.
we will have two again world leading speakers coming next week on the 8th of June. Okay, and the announcement will soon follow. And on the 7th of May, we will have a session, specialized session, training session, advanced training session on systematic review and meta-analysis, which will be offered completely for free, for which people are charging 2,000 rupees just for 2 hours. So we are offering that completely for free to all our participants. With that, I thank Dr. Tiwari again, and I thank all the participants for your energetic and your enthusiastic participation. The feedback link has been shared in the chat. Please feel free to fill it up. You will have only 30 minutes. It was shared about 5 minutes back. So it will be open only for 30 minutes. So please fill the feedback form. After that, do not send me personal chats. Fill it as soon as possible, because that's very essential to get your attendance for your advanced certificate program, and also for the workshop series participant to get your certificates. With this, we come to a close. Thank you, Dr. Tiwari. Have a great Sunday evening.
Yes.
We literally hassled you over a Sunday evening to come over here and spend the entire evening with us. But I hope it was worthwhile to spend time with us. So this program is in the format of a webinar, because unfortunately we do not have the kind of money to hold those big meetings in the format. The Zoom premium comes at a very high price. So thanks to one of our donors, we have got it, because it came at $200 per month. That's the price that we are paying right now, and thankfully we are able to manage it. So with this, we come to a close. All the participants, now you please fill the participation form as soon as possible. Do not wait and do not waste your time. Dr. Tiwari, I would get in touch with you personally, and I have a few other things to discuss with you. I would love to collaborate with you. Our global consortium of global health and the Global Health Forum would love to collaborate and work to further the agenda of One Health, so that we make a better future for everyone. Thank you.
Yeah, thank you. Thank you everyone for your time. I hope you enjoyed. I did. Thank you very much.
Thank you. Okay, have a great night.